It's been a full day. Welcome everyone to Senate Health and Welfare, and once again this will be our oversight hearing to work cooperatively with DCFS and to kind of see where the progress is being made according to what we've been working on. But before we get started, Madam Secretary, would you please call the roll?
Senator Mills.
Present.
Is present. Senator Barrow.
Here.
Is present. Senator Boudreaux.
Present.
Present. Senator Carter.
Present.
Is present. Senator Hingins. Senator Luno. Is present. Senator McMath. Senator Mizell.
Here.
Is present. Senator Pope. Is present. I have 7 members.
Well, thank you, members, and thank you, staff, and Ms. Peck and Ms. Cannon. Happy New Year to all of y'all, and Happy New Year to the department, and we look forward to working together the rest of this year. Just to recap for everybody, we do have the DCFS Child Welfare Stabilization Timeline that we've been working on, and that will be our continuation over the rest of this calendar year to see how we're hitting our targets and how we're kind of moving things forward and working with our new secretary on this. And congratulations, Madam Secretary, on taking this role for us. And we do have, I think, maybe some folks that do maybe want to add some public comment. So we'll see how the agenda flows. I know Representative Turner would like to say a few words, so we want to be respectful for his journey back home. So on that note, members, we're going to keep this like we always do, very informal. If there's some dialogue that anybody wants to talk about, or are we on a subject matter, we'll go from there. And we'll get started. So from opening comments, we'll get started with Madam Secretary. Thank you.
Thank you, Chairman.
We're going to put you on.
Okay. Thank you, Mr. Chairman. Senator Mill and members, thank you and Happy New Year. I'm happy to have this opportunity to speak to you at the beginning of the year to talk about our continued progress. You remember that in December, I shared with you that we're focused on a set of immediate short-term actions. We're wanting to ensure that we make a timely assessment of safety for every child we are charged to investigate through our centralized intake process, tracking our efforts to make meaningfully informed, data-informed decisions, engaging partners, and augmenting, deploying, and supporting staff to better help the children and families we served. Today, we have the executive team here, including our new Assistant Secretary for Child Welfare, Amanda Brunson, who you met before. Today, she joins us as the Assistant Secretary of Child Welfare, and of course, our Assistant Secretary for Family Support is also here, Ms. Shavonna Howard, and the Undersecretary, Dr. Eric Horn, is here as well. Amanda will update you on our progress toward achieving the 7 strategies that we've been speaking with you about. We also have leaderships from some of the lower programs, each of the programs, I should say, should you have any questions toward them directly. We first want to talk about a couple of news items that came out this week, including the Human Trafficking Month is this month. Most of the DCFS staff is wearing blue. It is January 11th is #WearBlueDay. I see several of you also got the memo, as they say, and we appreciate your support. It comes in many forms. We're honored to wear blue in solidarity with victims of human trafficking and in partnership with so many in this body and throughout Louisiana who are committed to fighting this evil. We have copies of that press release for you. If you haven't gotten them yet, they should be coming around so that you can see it. We highlight the work of the governor, the first lady, and this body, and including and especially Senator Mizell, who put this bill forward, that became Act 662, where all cases of suspected juvenile sex trafficking will now be reported through DCFS's Child Abuse and Neglect Hotline. We believe that this allows for a more streamlined approach for the public to know if I'm concerned about juvenile sex trafficking, just call the DCFS hotline, which for all of us to remember is 1-855-4-LA-KIDS or 1-855-452-5437. It's also important that this goal is to make sure that we're working together with our other partners like Louisiana State Police and those other law enforcement and the service providers and the Governor's Office of Human Trafficking. So we will be reporting, we will forward all reports of the cases that we receive to Louisiana State Police for investigation and, if appropriate, for distribution to local law enforcement agency. We have Ms. Christy Tate, who leads our Office of Human Trafficking here, in case there are any questions that if you want to have a deeper dive on that, we can do that. The other thing that came out today, and I think it's super important for this body, Chairman Mills, to know, is that we alerted the public that on the SNAP side, there is an end to the emergency allotments that came about due to the pandemic. 1 in 4 families have been served by DCFS through the pandemic. 1 in 4. When we share the news about USDA Food Nutrition Services stopping the extra benefits of the emergency allotments, we want everybody to be on notice because it's going to have some significant changes, not just for our families, but also to our communities, because this is a significant loss of federal revenue coming into Louisiana. As a result of the passage of the Federal Consolidated Appropriations Act of 2023, beginning in March, SNAP benefits for all recipients nationwide will return to their regular amount. These emergency allotments have allowed households to receive the maximum SNAP benefit for their size, with supplements not less than $95 per household. Each case is different, but I want to make sure that I can give you an example. A household of 3 with income might have been eligible for, say, $335 a month for SNAP benefits. With the supplements, this family was getting $740 a month. That is a significant amount of food benefit loss for any household. And so I think it's important that we recognize that in March, with the end of that emergency allotment, a family who has been using this amount for the last 3 years will drop back down from $740 to $335 in this potential case. These are 100% federal benefits, and they don't just assist households meet their food need, they also support our economy. We have worked with all the stakeholders to understand the changes, including the retailers in Louisiana, and I've asked our undersecretary to give me some numbers. USDA established and published a multiplier to help us understand the benefits of SNAP. And since the emergency allotments represent approximately $77 million of what we gave out last month, we expect that the elimination of the emergency allotments to have the following estimated economic impact. $770 million less flowing through Louisiana in 2023. That's 10 months without EA. That really could, if you use the multipliers online, reduction of $1.2 billion in Louisiana's GDP. So we'll have to keep an eye on not just our families, but also our economy. Our Assistant Secretary for Family Support, Shavonna Howard, is here if we want to talk about that a little bit more. We all share our concern for families with the loss of this benefit. There is nothing DCFS can do about the loss of the benefit, to be clear. We are working over this coming weeks to ensure that the information gets out. Families are notified. But you can imagine that we probably all need to be taking a look at our food banks in the area and make sure that they are plussed up.
So help us too, as we get calls. If somebody was in that allotment that they were getting about $335 and it was allocated to almost $700, is there anything that maybe that family had lesser income because of COVID? Is there anything that they can go back to basically say, okay, pre-COVID I was making X thousands of dollars, now I'm here,
Absolutely.
unemployed? Is it just a one size fits all?
No, sir. This is absolutely a benefit that is determined based on your expenses and your income. And so our neighbors who receive this benefit should always be letting the department know when they have changes in their expenses and their income. So it's a very good time to get back in touch with us if there are changes that they had forgotten to make before now that might make a difference in their regular allotment. And it may be that some people have not done that because they knew that everybody was getting
Correct.
the max. And we always knew that this was temporary, but temporary for something that lasts for 3 years is hard to put in your mind that it's going to end. What happens when it ends? And it's not a one-time, 1 month end. This is going back to forevermore. So as you can see, that's quite the bit. So
Madam
we
Secretary,
would say that they should.
Let me let Senator Boudreaux
Yeah,
jump in. He had a
absolutely.
thought to jump in on this.
I was just going to follow up on that communication, and I think you just said it. We knew it was temporary, and we understand
That's right.
the definition of temporary. But when you're on the other side and it becomes reality, and you've come to that, I guess my question is, with all the other things we're asking the agency to do, have you all had a chance to establish, throughout the state, working with religious groups, churches, other organizations? I think Senator Mills said it. I mean, they're going to call the office and say, somebody did something to me. But how or what is the rollout to reach everybody? And I know sometimes, we deal with it throughout LDH on issues. It takes 3 and 4 different communications before they realize we're talking to you. Those benefits are no longer there. So have you all had a chance to package how we're going to get that word out to thousands of people that are impacted?
Yes, sir. And I'd like to tell you that our communication efforts with our neighbors who receive this benefit started today with text messages, and our research showed us that the most efficient way of explaining things to people or notifying them is through text message. So there's multiple things happening, including letters, et cetera. So from excuse me, we have engaged the Louisiana Retailers Association, all of our SNAP assisters, Feeding Louisiana, 211 and United Ways, and our community partners to help us get the word out and to help people. It's going to be very difficult to fill that hole. We could go back and look at the cost of any food item when they first got the benefit increase to now and know that food is very expensive now. So it's going to have a bigger impact on people. We're sending out direct texts, social media, and we're using customized letters to send out to people. We're using all the different ways that we have been using to get in touch with people, and we want to do that over the next 5 weeks. Or the next six or so weeks until it comes back. We believe that we're going to have an increased number of calls coming in, just like you expect. We hope that they start now, especially if they have changes to be made, to look at changes in their income and those types of things. Now's the time to do that and not March. Because as you know, once it goes down, it's going to go down until we can recalculate. So if you want to give us an opportunity to actually touch your case now, now's the time to start making those updates.
Madam Secretary, would you
yes.
consider having staff put together a public service announcement that not only those of us who serve on health and welfare, but every one of the legislators, if you all could prepare a script that we can go to the media in our area with public service announcements, whether it's on television or radio, as you said, over the next 5 to 6 weeks, where we can get people's attention. We all know what happens. It's going to be after the fact, and we're going to be bombarded. So in addition to what you all are doing with text messaging, I accept the role of helping to communicate the good as well as the bad when it comes. And if you all would do that and send it to all of our district offices as well as our laptops, and then we can in turn reach out in our respective areas of the state to identify what the issue is and how and where we need to address it. So I appreciate if you would consider that with the team and anything else that I could do to help. This is big.
It is significant.
It's going to
Senator Boudreaux,
negatively
thank you.
impact a lot of families.
Yes, sir. We will definitely do that.
Very
Thank
well
you.
said on all sides. The board is, many senators do want to comment, so let's continue this dialogue. Senator Carter?
Thank you, Mr. Chairman. Thank you for those remarks. I only have one quick question. Is there any effort underway to extend those benefits in any sort of way? I'm hearing a hard deadline is coming up of March, but is there some effort behind the scenes that should be come to light or something like that to hopefully resolve this extended of some sort?
So it's important to know that there is a food advocacy that is happening nationwide, like almost all the time. But I think that you'll find that they're really working right now to make sure that USDA Food Nutrition Service is prepared. But it's not them, it's Congress, right? So this was part of the budget. And so it will take literally an act of Congress to change it and determine that where the SNAP allotments should be. So if anyone is making their way to Washington, D.C. anytime this month, it would be a good time to talk about it with our federal partners. And it is nationwide. So we can also share any of the advocacy work that's happening with you all so that you can see how you might be able to lift this up also for our congressional delegation.
Thank you.
Thank you.
Very good question. Senator Barrow? Madam Vice Chair.
Thank you, Mr. Chairman. Really quickly, and I appreciate my colleagues' comments as well. I just want to ask you, Madam Secretary, have they already started making cuts? I've received calls from individuals who have noticed a decline already in their benefits.
Thank you, Senator Barrow. There have been a few people that have lost some SNAP reduced because of SSI, where they had the big COLA increase. That is considered to be an income. So when the COLA increase went up, then some people's SNAP benefits went down.
Because they were elderly. So that means
Yeah.
that they're going to have a double cut.
They won't be cut in addition. That is correct.
Jeez, okay.
This is definitely, not all states were asking for the extension every month like we were. There were some states who did not extend the allotments like we did. And so now there's no more extensions available to us administratively, so it would have to come from Congress.
Okay, thank you. Thank you, Mr. Chairman.
Thank you very much, Madam Vice Chair. Madam Pro Tem?
Thank you, Mr. Chairman. Really quick, I love Senator Boudreaux's suggestion because I have rural districts. They're going to have a very small window to get the message out. And my request to you is if you could include any additional information that the food banks, maybe Second Harvest is, adding new delivery options or distribution points than they usually have. But I'd love to share that. So just whenever you get it, we'll figure it out. But
We'll have to all become food advocates. I think that's what it is. And even in my faith-based community, there's talks about how can we all add some of our overflow to the food banks to help people. And we want to continue to make sure that people remember that if you're not sure where to go, call 211. You can find the address to someone that can help. Maybe someone's doing a hot meal each week or something like that. Maybe you don't know because you never used food bank before. How do I get there? Or how do I go and make my delivery to the food bank to share with my neighbors? I think this is when we get back into, am I my brother's keeper sort of place, right? We're going to have to take a look at what's going on and see what we can do.
Well,
so
because
we'll bring that to you.
there are layers. If you don't have transportation to get to the distribution point
Exactly.
on the day it's being done, then you've got
Yes.
to, yeah.
And it is important to note that some of the changes that we made in the recent couple of years does include using online, using the benefits online. So that's a good part of SNAP, right?
You know
So-
my problem with that.
Go ahead, tell me.
We don't have broadband.
Yes.
I may have mentioned that a few times.
And you know, it's so great.
But it's
though.
really difficult when you can't go to the site and navigate because
That's
you,
right.
Yeah. So
I
it's
didn't
just
know
one
that.
more piece of the puzzle that
Right. And the broadband office, so we're excited about the fact that there's work going on for the extension of broadband,
Right,
but we
right.
find ourselves in a space where we don't have it everywhere where we need it. So,
But thank
very
you.
good point. Absolutely,
I
Senator
appreciate it.
Mizell.
Thank you, Mr. Chairman.
Thank you very much. Senator Luna?
Thank you, Mr. Chairman. Recently, I've had some conversations with some state agencies about the increase in the Social Security benefit, the COLA increase there, as it dealt with people being eligible to be Medicaid recipients, and sometimes they get bumped off the rolls in a similar fashion as this. And what I was told is that while that happens, until there is a chance for an adjustment, that the agencies will flag all of those accounts that got knocked off that way and make sure that they don't get removed from those rules. I'm wondering if there's a way to do a similar thing with SNAP benefits until we can make some adjustments in our numbers, because this historically, with the increase, with the COLA increase, this happens from time to time.
It does. I mean, the good thing, I think, Senator Leno, is in this case, those who are eligible. They're not going to become ineligible, right? Just by this change. It will be about the amount that they're getting. So the emergency allotments, we're able to flag those,
Okay.
you know, how much of each case is an emergency allotment versus a regular allotment. So we will be able to use our data systems to make whatever adjustments we may need to make. This is sort of a little bit of an all or none. I don't know if maybe Congress might consider a lower allotment or something like that, but we would be able to go into the systems and spread whatever new allotments they give to us. It just takes a few days working with our partners to make those changes.
Okay, thank you very much.
Thank you, sir.
Thank you very much. You gave us a great explanation. But I guess to kind of recap everything from a political standpoint, a lot of people in Washington, D.C. over the Mardi Gras festivities. But if we do get that call from somebody, we do know from talking to the constituent that they're making less money, they've lost their job, they're not where they were pre-pandemic, there is hope if they contact the department.
Absolutely.
Okay, very good. Please continue opening remarks. You got a lot of good discussion on this one.
Thank you. So we continue, I mean, this discussion just really highlights what's happening nationally and how it impacts us in this state or locally, right? So that is the same for domestic violence, drug use and abuse, violence. All these things will tragically impact the most vulnerable, and that's our children. And so we'll need to be taking a look at like what's going on for summer feeding, et cetera, right? So we are continuing, though, to give our full attention to strengthening our workforce, because as this conversation yields, there'll be maybe even more families to help in maybe other ways, right? So in child welfare, this is, though, our most critical factor. Economic stability, though, is really like a prevention tool, which is why the SNAP changes are very important to us in our discussion about child welfare. We talked last time about how far we had come in our hiring fairs. After our last conversation, we had an event in Baton Rouge that attracted 260 people to the hiring fair, and 2 events are scheduled next week for Bossier City and Alexandria, and then we will make our way back to New Orleans, as we still have a significant need in New Orleans. From our hiring fair so far, we've had at least 183 offers actually accepted, and pending final acceptance, 75 in child welfare. And 114 of these 183 have already started with the department, so we're continuing to make progress there. It's all good news, and it still takes 6 months for a worker to be able to take full caseload. And so there's training, and then there's a partial.
As you're looking at those numbers, what is your retirement projections for 23? Your retirement projections, how many people you think
retirement.
on that same batch are going to be retiring? Are you just treading water, or are you able to add to the pipeline?
So thank you for that question, Senator Mills. And I'm excited to be able to say to you that we're working with some new data. We have a provider that a contractor that we've been working with, Ms. Betsy Reveal, who has taken our HR data and our caseload data, our leave data, back 5 years in child welfare so we can do some forecasting on those things. So we continue to have approximately a third of the staff that is in a window where they could retire. Fortunately for us, child welfare, they don't retire very well. When they do retire, they come back. They wait to retire, but that's a very significant question for us. When they do retire, we try to keep them chained to us and have them come back as a WAE. But that question is one of the questions that we'll have in data to be able to share with you next time. We're working through this data and working even with it right now to share with the governor's office and the commissioner so that we can take a good look at, even if 100% of my vacancies were filled and we were looking at 100% FTE, we would still be short the number of personnel that we need in child welfare to meet the caseload standards for that area. So we have that data. We're reviewing it now. We have it for foster care and we have it for CPI, child protection investigations, but we're moving it also through family services and the other program areas like adoption so that we can give you a very full picture of that. This is the thing that everybody wants to see. How many more staff do you need to stabilize your caseload? So we're working on two things. One is that question, can people go home at night? Well, unless they have to go to court and stay there all night, they should be able to go home at a particular time, and we should be paying them fairly. So we're moving those two needles. We're working with civil service, we're working with the commissioner to actually balance out how many people does it actually take, full-time equivalent staff, and we know that we have to factor in things like leave and other things. And so there's some exciting data being processed right now. I can tell you that right now it looks like we're probably quite short. And so we'll get that. And if I get the answer before we come back and see you, we're going to send it to you in email so you can actually see the data as it rolls out. Is that okay?
Oh, that's perfect. Thank you very much for the answer.
Thank you. Well, your questions, though, lend to one of the problems. So I'm always asking myself, what problem are we trying to solve? And so one problem that we try to solve is even while we hire people and we bring them on, this 6-month delta before they can actually take a full caseload, it's important for us to bridge that work. And so we, and I told you about this, are using what we call I always ask the team, a critical incident support team or assist team made up of approximately 30 to 35 people from the family support side of the house who have previous training or current training that would be conducive to bridging the child welfare staff until the new people are fully trained and can actually take over that area. So in addition to new leadership, and I say that not just a new manager, not just an administrator, but new leadership leading that area. We have the SIS team coming in to support. And I have to tell you, one of the most exciting things I've done so far sitting in this seat is meeting with this group of employees on Monday as they came together to start the work, to see how excited they were to be a part of the solution, to stabilizing and helping to stabilize until the new persons come on board. So the employees of the Department of Children and Family Services continue to make me proud. So we're developing a similar team like that for New Orleans as we're looking at what is also a critical stage in New Orleans. It's also why we're doubling back to New Orleans to do another hiring fair. We don't have that information yet. When we get it, we will send it out to you all about what we're going to do in New Orleans. But when we look at why the SIS teams are necessary, it helps us to bring back up the caseloads. So in Baton Rouge in the past 6 months, we have investigated 1,466 cases, July through December. That's 36% increase over the same time period in 21. So, in the month of December alone, we increased 41% over the same month the previous year. So, when we think about those cases, remember we've talked to you about certain priorities. Priority 1, you're supposed to go out within 24 hours. Priority 2, 48 hours, et cetera. And of those 243 cases, 3 out of 4 of them were priority 1 or 2. So this is not just the case coming in. It takes a lot of time, and 29 children had to be removed from their home in December in Baton Rouge region. So picture in New Orleans is not better. The New Orleans region saw a 57% increase in cases investigated over the past 6 months, over the same time period in 2021. A 57% increase in cases, right, year to year. So in December alone, 348 cases in 2022, 248 cases in 2021. So our societal problems are bubbling up through our caseload, which means the children are not okay, right? I mean, that's what it means. The children are not okay. And so it's important for us to be able to continue the work of stabilizing the workforce, adding to it to make sure we can actually get to these cases. It's not like I can come to you and say, well, 50% of them are like lower risk. That's not the case. The children are not okay. So in New Orleans, we had to remove 25 children for their safety from their home. So I talked to you about the models that we're using we're currently using these models to create what are the actual casework levels based on all these calls coming in, and what are the staffing levels. So we're going to be able to tell you how many cases came in CPI, how many children were served in foster care, how many kids were served in these other in family services, how did the caseload compare to the model that we forecasted, how many total positions were assigned that month, meaning how many people were on board and how many people were on FMLA, right? Very important number, right? Because it might mean that I need, and so far it's showing me that for every position that I need, I actually need 1.3 people because of the amount of leave, FMLA and other leave that people take. So these are the types of data that we will give to you. How many were filled? How many were vacant? What was the caseload capacity of the people that were sitting in the chair? Meaning, what percentage of the cases that are coming through can we really reasonably handle? How many more cases could the vacant positions handle?
Let's take just a little break because
Yeah,
Senator Pope had a question.
absolutely.
Because I see as this will break in between.
Yeah,
Yes.
thank you, Mr. Chairman. You touched on numbers, you touched on the increase in percentages, et cetera. I want to drill down a little bit because do you have any inclination as to what's causing these significant, to me, increases?
Yes,
I mean,
sir.
you touched on societal or whatever, but could you be a little more specific?
Yes, sir. I would say to you that as we looked at some of the more serious cases, the very largest amount of them have drugs involved with them.
That would be my assessment.
Yes, sir. So it is my intention. We're working with Casey Family Programs, but also ACF to see, is there anything new that can help us with this? But society, I think we have to be able to, and we've been working with Secretary Phillips to be able to answer the question and move people to a campaign to say, if you or somebody else has an addiction or a use problem, or do you understand that if you have drugs in your home, children can die, right? Because everything that you think, it seems that everything you think is recreational could be laced with fentanyl. Right? And so we really have to, open up our mouths and help people to recognize the dangers to children in this situation, especially, Senator Pope, as you know, a toddler who puts everything in their mouth, right? And that's where the danger comes in. That's why, with your help, we were able to change a policy to help us understand that children in the risk, and if we're hearing from them, especially from medical professionals, that there is a problem, that we need to go out. So that change in policy is part of the increase in cases of looking at those P1s for children that will be at higher risk because they can't speak for themselves and because they're natural way.
Part of it could be the household, the parental aspect, or the people that are in charge of that. Is any thoughts on how we can, I mean, you know, I've been trying to fight this for 60 years as far as helping with that, but there's no golden answer that I've found. I'm hoping you have one.
I have no golden answer. I have to tell you that, you know, recently in some readings, you look at thousands of years ago, and people were still talking about how harassed and helpless people are, right? Like, we have to be able to look around and see if we can help people in our other communities, in our faith-based communities, right? In our neighborhood, like if we're realizing that people are struggling, you know, can we step in somehow? And so I think I pointed you guys to 211 and to the Kinship Navigator resources that we have, where you can step in on behalf of a family member and help them. But the truth of the matter is that people help people, right? And so if we want to get to the point where people don't have to come to the department and be known to us for help, that means that we're helping each other. We, the big we, all of us, looking for help, looking for what is wrong and stepping in and helping people say, you need to stop doing that.
Well, I guess I asked the question about the numbers and the percentages almost doubling, if you will, in some cases.
Yes, sir.
You know, what's going to happen a year from now if they double again? You're going to go back to staffing issues and those kinds of things that we'll have to deal with.
Yes, sir. And we're hoping, Senator Pope, that this new data set that we have will allow all of us to see where do we stand.
Yeah.
And we're looking at caseload forecasting based on actual numbers coming in. Then we might be able to say, you all will be able to look at the forecast and say, okay, we do need to add TO or not, or we need to add a particular type of unit or not, like we did with human trafficking. Like, there's an ill, it needs a new look, so we added a unit, and we're going to have to keep doing that. I think that's our job.
That's
Yes.
going to be an ongoing process.
I think you're right, sir.
Thank you, Mr. Chairman.
Thank you, sir.
Senator Mizell?
Yeah, since this is a conversation, thank you, Mr. Chairman, I'd really like us to broaden to Senator Pope's question. I just came from a conference on maternal health and the correlation between caring for yourself as a woman who's about to be a mother and knowing how to care for your child and becoming the parent that we all want to see is just like this. And I think, you know, just like, you know, we can't take trafficking and put it in one bucket. It's touching everything. I think if we look at how we're treating women who are dealing with motherhood, it's layers of opportunity to change the outcomes that we keep seeing. So I look forward, frankly, I'm opening this up because I look forward to a conversation with you on ways that we can do that for the long-term good. Mm-hmm. And I think we Senator Barrow, my buddy here, you know, she just showed me some information on how many bills we keep putting out, you know, and we keep throwing rocks at these horrors within our society, and I think we need to look at the bigger picture. Mm-hmm. And that I just wanted to get that off my chest.
Thank you.
Because I think, you know, we are so incredibly frustrated, but at the end of the day, we have children who are living miserable lives, and I think we've got to back up and look at how we can change it for the next generation, not just next month or next quarter. And anyway, well, thank you. I appreciate it.
On that same note,
Thank you.
Vice Chair Barrow.
Yeah, absolutely, Mr. Chairman. Exactly on the same note. And I don't want to really call out any particular entity, but I have been told, and I think you're right on to something, if we're able in the very beginning, because sometimes individuals find themselves in those situations not by choice, and so they give birth. And then if there's no system or no a place where they can receive support, then it just become more of a systemic problem in terms of abuse. And so there are individuals who are working in our hospitals who see these cases immediately. And I want to see how, at least our nurse partnership program, which I think what may be the best entity to probably help, how we can really bring that together, because they are leaving the hospital, and there's statistics that prove that if you're able to help that mother in the very beginning, the likelihood of her really rising to the occasion and becoming a good mother, even though she may not have good support in her life, are 100% better. And it seems like there's still a gap there. They are not getting the support they need. They be in the hospitals, I think. And when we talk about some of these tranches and buckets of money, like this opioid money that's coming down, there needs to be a portion of that money that is going to assist these women at the beginning of birth with these children. And I too look forward to that conversation, because I think that's where we need to really, that's one place where we can start. We have a lot to do, but that's one place where we can start.
I agree with you, Senator Barrow. Thank you for bringing that up. And I think this is where we talk about even prenatal, right?
Yes.
Where WIC can come in. And in some recent conversations, we've been talking about just how well aware people are about what comes with Medicaid, where they can get resources. Do they know how to use their Medicaid to their benefit? But we know even though with Medicaid there are still providers, a lack of providers throughout the state that actually take the Medicaid. So we do have some significant conversations to continue, and we're right there with you. We believe that the work that we've been doing with No Wrong Door, to include 211, to include using the Unite Us platform to be able to provide case notes throughout multiple providers, so that we can all make sure that we're actually helping each person well, and we can see what's going on in that household, is very important. So we'll continue to talk through those things. We believe that the Nurse Family Partnership is one of the best programs there is. We do have several other evidence-based programs that are coming out, that are rolling out through the Families First Prevention Services money that federal government, this change to prevention in child welfare. And so we have some more, and maybe our next time we will share more about those prevention programs, so you can see the evidence-based programs like Nurse Family Partnership that are slated to make a difference. Those programs like Nurse Family Partnership are able to receive more money to have more people be served by them. And you're right, if we can get into a family with that child in the beginning, then we're probably going to decrease the ACEs, we're going to increase resources, we're going to increase their ability to learn throughout their young life, and we know that's where the trajectory starts, right? Either they're going to have this kind of life or this kind of life, and it matters in their early learning. So we're with you, and we're happy to sit at every table with you to continue to have those conversations and bring the other evidence-based practices to that.
I know that you guys have a lot. You have a lot going on. You got your hands, it's like an octopus, all over the area. But I'd like to know in terms of the practical application of how that's being applied, because it seems like, as I speak with individuals who are working at the hospital, it's still a tremendous gap, and I would like to see how we can definitely shore that up.
Absolutely. Thank you for the opportunity.
Thank you.
Thank you very much, Madam Vice Chair. So continue,
Yes,
and
okay,
as I
very
see the
good.
committee ask questions, we'll just keep the dialogue flowing like we're doing.
It's so important. Thank you for the opportunity. So we'll have Assistant Secretary Amanda Brunson is going to come up and walk us through our 7 strategies like we did last time. And I think you're going to see that we're making significant strides in these strategies that we've created. But if we keep having the ills of life negatively impact children, we're going to keep needing more and more, like Senator Pope said, people. So let us walk you through this. I know this is one of the main reasons we come. The dialogue has been very helpful. I continue to be so grateful for all our partners who are helping us, and you're number one on the list, as is Civil Service, Workforce Commission, Department of Health, the Governor's Office, the Commissioner's Office of, and OTS, Technology Services. Everybody's coming to the table, and so we appreciate that, because the children are not okay, and we're working to make sure that we can help them.
And we do want to get that overview, and we like going through it, and we're learning as a committee that here's the high points. I guess I'd get kind of to the punchline right away. Is there anything on the task sheet that you say to yourself, you know what, we're not there. We can't get there yet. The timing is tough. We need an extension. Is there anything from a highlight, and then we'll drill down, but getting to the punchline, is there anything that you look back and say, okay, this one's tough?
There's not. That immediately rises to the surface. And good afternoon. Thank you, Mr. Chairman and members of the committee. I'm Amanda Brunson, Assistant Secretary of Child Welfare. And if I may just very briefly, before we dive into this, say that you are speaking my language. I spent 16 years with an organization called Prevent Child Abuse Louisiana. And so all of the things that you have just talked about is where I come to this role from. And immediately prior to this, I was the Director of Women's Policy, so the maternal and child health piece of it is so important. And I'm not going to go through a long exercise, but I think it's very helpful for people in general to see this picture of what it really takes if we want to support children and families and we want to get out of the situation that we're in. And so if you picture this childhood trauma and this place that we are in with so many kids with ACEs and with child abuse and neglect and all these things as a raging river in the center of your brain, if you picture that raging river and children are falling into that river, there's a couple of different pieces of this map that are really critical. And so the role of the department in child welfare is about the swimmers who go into the river, right, and come and bring children to shore and assess their safety. There is an entire village on the bank of the river that is made up of court systems and of CASAs and of CACs and of the Department of Education and all of the service providers that it takes to really do the intervention and treatment piece, you know, once we pluck kids from this river. But the bigger picture that you've all been talking about today is, why are kids falling in the river? You know, and to really answer that question, we have to go upstream and we have to look at all the bridges that have holes in them and what are the opportunities that we have there to make a difference, and that's primary prevention. That is where our Family Support Division lives with economic stability programs. That's where the Nurse Family Partnership and a lot of those core, that's where your power-based violence work is that you've done, that really is talking about how do we keep kids from experiencing harm in the first place? Because those are not the families that we serve in child welfare, right? We're serving families that we've already, they've been harmed or they're at risk for harm. So I just want to say that there is so much work to do upstream. There's so much work to do in the river where we are, and there's so much work to do on the bank of the river. But we will never stop needing that bigger, busier village on the bank if we don't really collectively go upstream and fix the bridge. And so we have a large bucket of work, including this timeline here, where we're at the river. And so if we zoom into that piece of it, I just want to say that we do have several priorities right now and that are reflected in this timeline, but we also have a lot of priorities that are outside of this piece that are really about making an impact at the field level, where these strategies, several of them are more about our systems change and some things that we think we can do better. So in general, I will tell you on the timeline, we are on track, and every time we have had to move a date, we're wanting to call that out explicitly to you so that you can see it. So that's this other document, just as we did last time. We've removed the red of the previous changes, and now everything that you see red on the timeline are the things that have simply changed in the last roughly month since we saw you last. And so there's not anything in particular that I want to call out here. I'm happy to answer any questions, but I think we really have spent the last several months in the gear up phase of all of this, and now we're in the rollout phase where we're going to start to see some impacts from this, and where we're getting into monitoring effectiveness and things like that.
So from when we had our very, very first meeting, and there were so many people of the public, and we do have Representative Turner would like to speak too, and he has some constituents. Talk to the public of what meeting these achievables has meant as far as the overview of the department. Bless you. Of the department itself. I mean, talk right now. We're getting very technical, and we're understanding the technicality of all this. But talk to the public to reassure them that from when we first sat here as a committee, and we said we would meet every 6 weeks to make sure we're moving the needle in the right way. Talk to the public about how they can have even more confidence in DCFS, and where's the success and where's the challenges still pending.
So let me speak here, and Amanda can go through all these as much as she'd like and add to this. But it's important for me to talk to you about what I'm learning, right? And so it's an important shift for me to move from the deputy secretary to the secretary and now look at the whole of the department. And I will have to say that we've done several pieces of research. Last time you guys heard from Louisiana legislative auditors about what they found from employee satisfaction. We've also had research turned into us by Drs. Park and Robinson from the Leadership and Human Resource Development School at LSU that underscore a lot of what we got there. And we need the culture to be positive so that we can reduce turnover and tension in those who are already here. That's important work. The other important work is for me to understand what is the public saying to me. And I am getting reached out to the public, and I think I'm glad for that. I'm glad that instead of just coming to you all to say, this is my problem, people are definitely making their issues known to me. And so I would say, as I have capitalized or sort of categorized in my mind some of the various issues that kind of bubble up to me, either from the employees, from management, or from the public who are having direct with us, there are people who are coming to tell me that things are right. I've had people to say, like, wow, they're underscoring and understanding the courage it takes to work in this department and some good experiences that they have had. So there are things that are right. There are things that are wrong that are coming to our attention. Someone did something wrong. Either they for example, maybe confidentiality was broken somehow. Maybe they cheated time, and that allegation is coming forward. Wrong is almost easier in these three categories that I'm telling you about, to be able to do an investigation, figure out what happened, and then address it. Whether that means training, whether it means some kind of disciplinary action, maybe it means removal. Whatever it is, when someone brings something forward that's wrong, it's kind of simple. You deal with it. But then we also have these other cases come to us that are things that I call it right versus right. You've got multiple loving adults who want a child. You've got, cases where all of the CASA, the child welfare worker, the medical professionals, the judges, all the different lawyers for all the different parties, the school personnel, the neighbors, they all have a different opinion about what is in the best interest of the child. Those that come up to me, those right versus right sometimes, it really can be a this is what I think is right. Those are the hardest for me to parse through. And it's hard because families want to help, people want to help, and yet it's necessarily going through the legal system, which is adversarial by its nature. And so these are the things that are harder for me as a secretary to really figure out what to do, so we're cataloging them. One of the most important things to me is not necessarily to figure out, like, who did the wrong thing, because in a right versus right thing, it could be, how did it happen? What decisions were made? What was it based on? And what processes need to be considered? That's what I'm looking for. Because in the end, if a court makes a decision that is different than the agency puts forth, or in keeping with what the agency puts forth, it's the judge's decision to make, and we'll have to sometimes make decisions on whether or not we believe that it's so egregious and against what we consider to be the law that we'll put forth something legally to go against it. But the most important part is, are the staff that are working, do they have what they need to do the work? And or are they doing something wrong? In the case of, you know, people being in court all day who have multiple caseloads, you know, we continue to try to work with the courts, for example, to say, is there any way that you could call us an hour before you think our case would go? Otherwise, they're in court all day waiting, right? And so there are a lot of things that we can look into and figure out which ways can we make things better on behalf of the employees. But these right versus right things that bubble up through the system, those are the harder ones. So as we go through this, I would say we're looking to change whatever we can, and there are a lot of things that we cannot, and we're stuck right in the middle of it. And one of the things Amanda and I are trying to do is to go to the root cause analysis of whatever happened in this case and to figure out what needs to be addressed. So I'm going to say that to say we're going to be doing that work kind of like forever, but we're hoping that in this first quarter of she and I doing this work together, along with the rest of the administrative staff, we're able to ascertain some things that really need to be addressed. They are likely in here, and if they're not, we will have to add them.
Turn it over to some of the committee members. Vice Chair Barrow, you first.
Thank you, Mr. Chairman. I greatly appreciate this, and I want to do a disclosure, a personal disclosure, which I am very hesitant to do because no one never wants the general public to know about personal things happening in their own life. If someone would have told me 3 months ago that I would find myself having to go through this process and going through the system, I would have told them that they were lying, and I would have told them that the truth was not in them. Well, within the last 2 months, my family have been going through, having to work through issues and personal things as it relates, and having to go through DCFS. It has allowed me to see the good, the bad, and the ugly. There are some incredible people working in this department. I have had the opportunity to be in court for 8 hours, more than one occasion, not being able to eat, probably as the staff was as well, trying to delve through and work very hard on some of these cases. I've asked the chairman to help me navigate to avoid being displayed because I'm doing my job, that I am being adversarial to the department because I've asked questions. So I am asking the chairman if he would help me, help us, because there is a lot of work to do. And Madam Secretary, one of the things that you have said that has given me a great sense of relief is the children are not well. And that is the first inkling of being able to heal and begin to get on the right path. It's acknowledging that it's not working. And I'm going to tell you, I have saw some things that have just been utterly appalling. My mother, because I'm going to make that real clear, I'm not going to let anyone hurt my mother. I do not disrespect my mother. I have siblings. My mother is in her 70s. And some of the things we have endured and gone through have been utterly disgraceful. So as I work with the chairman and some of my committee colleagues in the department to make what we can right to address it and hit it head on, because you can't address a problem by acting like it doesn't exist. I look forward to that. And in the process, I am prayerful and hopeful that my name is not scandalized in any kind of way because I ask the hard questions about somebody doing their job or doing what they are responsible and tasked to do. So I wanted to get that clear, and if I say it first, then nobody else can come and say it because I've already acknowledged it. I'm not afraid of taking on big issues. I have never been, never will be. And at the end of the day, everybody in here, in this whole entire Capitol, know how I feel about children. And I will stand for them until there's no more breath left in my body. So I thank you, Mr. Chairman, for giving me this opportunity. I thank you and Senator Boudreaux, Senator Mizell, for you guys listening to some of the hard things that have happened and that have occurred. And Madam Secretary, I want to thank you for helping us, because when this whole process started, it's such a violation when you're doing what you think is right, and then all of a sudden things begin to unfold. We didn't even know where to start. And oftentimes people don't even know where to start, especially when you're being blamed for something you didn't even do. So it's intrusive. And some people don't even want to rise to the occasion to come and help because they don't want to be a part of the mess, because it's messy. So I just want to say again, Mr. Chairman, I appreciate you, and I thank you guys for working with me to work with the department as we navigate this so that it's done properly. And I am not in no way, form, or fashion, which we may not be able to avoid anyway, but at least we have said it publicly, my name is scandalized. Thank you.
You know, Madam Vice Chair, I guess personally, I've worked with you for 15 years when we were in the House together. And everyone in this building knows your heart, and they know you've been through so much. And I can tell you from Ms. Peck and Ms. Cannon and the staff that we have here, anytime you need us, we will be there for you. Sometimes some of the best meetings are close one-on-one meetings, so we will be there for you. So you just rest assured that you've got a tremendous amount of love and friendship here, and we will not leave you alone.
Thank you. I appreciate this.
You got it. Thank you very much. Senator Mizell?
Thank you. And this woman is a champion.
Yes.
And yeah, thank you. Thank you for your words. Thank you for your commitment. I'm going to follow that with just kind of, we get emails. I think everybody on this committee hear from people. And I'm going to kind of go down the rabbit hole because this conversation deserves some attention. And I understand, right? You're dealing sometimes with right versus right. Sometimes it's right in what appears to be very wrong, not criminally wrong, but a decision that makes no sense on the surface. Okay, and I want to kind of take you back. Senator McMath, I'd hoped he was here. He's not here, but he did a bill all about long-term placement in 21. And within that bill, and this is what I want you to tell me, within that bill, and I'm going to read it because I want to be really clear, in section, I guess it doesn't really matter, Section 2, item B, it says, in the event of removal from a placement with a current caregiver pursuant to subparagraph A of this paragraph, upon motion of the court, motion of the current caregiver, or motion of the child, which is filed within 15 days of the change in placement, a contradictory hearing shall be held to determine whether removal was in the best interest of the child. How often does that ever happen?
Oh, I'd have to go back and
I mean,
we have to do
is
a
it a
hand
normal
count on that.
Yeah.
I don't know how many times that has happened,
But
I can find out for you.
But when what appears to be right, you know, a long-term placement that was without fault, there was no concern within that long-term placement, and this is not you all. This is frankly a judiciary act here. But I'm trying to understand how the points of view could be so different, because at the end of the day, the damage to the child is still the damage to the child. And if we're saying that we've all accepted the fact that long-term placement is in the best interest of the child, at what point do we all get on the same page, or with a contradictory hearing? I mean, school me, because I really don't know what happens with the contradictory hearing, or what's the likelihood of the initial placement being returned with the contradictory hearing.
I don't know the answer to the percentage or likelihood. I can tell you that this is where the judges has to make the determination
Right.
about
Right.
what is in the best interest of the child. And I think this bill created a presumption that the long-term placement is best for the child in a case where we're not talking about removal back to a parent,
Right.
right? But it is a rebuttable presumption, and that is why it is a legal proceeding. And unfortunately, it's not a mediation, a contradictory hearing, right? Like the
There's no
parties are
gray.
going to make their cases,
Right.
and you know, there is something that kind of has gone with me as an attorney and as, you know, a mediator, that says the first to present his case seems right until another comes along. And it is no reason, I mean, it's one of the reasons why, no thank you, I don't want to be a judge. I don't. It is very difficult. And here's the other thing, the thing that really bothers me the most is that likely the person with the best attorney is going to win.
Well,
And that's not always the case, but then that gets into, you know, people being represented well, having access to justice is a whole different conversation. And so I don't envy the judge who has to make the determination about what's in the best interest of the child when a child has an attorney, the parent has an attorney, the foster parent has an attorney, you know, the department has an attorney, and everybody's making a case presenting evidence. And as we know, no one person has all the evidence, and evidence can be contradicted.
but is there an opportunity for an appeal outside of a contradictory hearing? I mean, is that the only?
Senator Mizell, you're going to make me bring my general counsel up here because I don't practice in the courtroom. But we'll let Senator
Okay,
Luno.
he's saying yes.
There
he's,
you go.
he's- yeah. But the other point because you are sitting here taking the arrows, bless your heart, because this you know, like I said, we get calls. I don't know how to help. You know, on the surface, it's heartbreaking. What is the thinking that does not allow contact with the child after they've been removed from a long-term successful placement? What is the thinking that forbids the person who's put themselves out, that we ask people to do, and they've had that child over a year, for instance, and they're cut off and told they're not allowed to speak to that child? Do you know
Mizell,
what the thinking is on that?
So I'll say this to you. To follow the vice chair's vulnerability, I had custody of my sister's children for 2 years. When I returned them, they didn't let me see them for years afterwards, just because they didn't want to. And we have a beautiful relationship now, but that was a very difficult period.
Right.
And it's to underscore that a parent has a right to make decisions about the child. And if it's a parent that is placed by a rule of law, they have the same decisions. Now, if you're saying that the department is cutting them off, I don't think that's the case. But if it is, and we want to know that, but the only reason that you know, somebody can say you can't have access to this is if there is parental decision to cut people off. I mean, people make those decisions all the time. You will not have contact with even some family members.
No,
right?
I understand that if it's the parent, you know, or the whoever has
Or the
custody.
adoptive parent or the custody,
But
right.
no, this is bureaucracy, either the judge or DCFS. And I've been
forbidding.
told, I'm just laying it out there. I've been
I
told
know.
this many times, and I'm always just dumbstruck by what thinking is it that thinks this is a healthy transition for the child to not see that. So this is a conversation we can have, but I didn't know if there was something that was just a standard. Well, no, we whatever. So there's
No, ma'am.
there's no thought process.
No,
on
ma'am,
that.
but we are having we are attempting to have meaningful transition meetings between placements and families. And so I think that, to the extent that we're finding that a transitional plan is not working well, then it might go back to what I said before. If we're finding that somebody's making decisions based on wrong things, if a process is incorrect.
Right.
Those things, I want to know that. And whenever something comes up to us, I'm looking at a root cause. What's the root cause of this? Is it really just one of those cases where reasonable minds could differ? I mean, we've seen cases where two articulate and decorated professionals have two different answers to what's in the best interest of the child based on evidence and based on medicine and so, I mean, we're always going to be in that case where people could think the best thing is different. I mean, it happens in every manner of life, and it certainly happens here, and especially because people believe that I can do the best thing for the child. And well, the other person on the other side believes the same too. And it's not an easy place to be.
No, but I think that's
Anybody.
where, and I'm going to close down. I know the chairman's got other people
Sure.
waiting, but it's where we say, okay, is this in the best interest of the transitional parent or the best interest of the child? That's an argument. Well, you and I will have to talk about it. I don't know of a situation where the child shall never contact the person they've been living with for the
Unless
last
it's
year.
for their safety and someone has
Well, no,
made
this
that
is-
determination,
yeah.
then I'm with you. Let's talk about it and figure
Yeah,
out
yeah, we'll
the
figure it
case and
out.
if there was
Yeah.
something, really there. Thank you, Senator
Thank you,
Mizell.
thank you.
For constantly keeping the
I
conversations.
appreciate you taking my call. I really do. I appreciate you letting me share concerns I have with you offline, and I just want you to know I do appreciate
Thank you. Yes.
Very well said. Well, you're almost the most powerful person in the Senate. We got to take your call. Senator Luno?
Thank you, Mr. Chairman. I want y'all to indulge me for just a minute here. A lot of years ago, Mr. Chairman, when I had brown hair, as a very young lawyer, one of my jobs that I had, in fact, one of the very first jobs that I had, was that I worked in the juvenile court system. And we had what at that time was considered to be a pretty good program. We had a good juvenile court system there, and there weren't many of those across the state of Louisiana. And let me tell you at that time what was recognized as a good system. Brand new lawyer, just out of law school, I represented every juvenile kid in Rapides Parish that did not have a private lawyer. Every one of them. Wow. And that was considered a good scenario. We had an average, we figured out an average of how much time we spent on a case, and we averaged 12 minutes per child. Wow. That's unconscionable. Often, we did things that did not make sense and turned out to be bad decisions, but it was because we didn't have the information. And I agree, when you have right and right, that's the perfect situation, because so much of the time, kids come through the system and nobody gives a damn. That's the tragedy. But when you have people who are competent and that have different points of view about how child placement should go, that's a good thing, even if it means they're come to court and fight it out. Because honestly, that's where the majority of the time is spent in those courtrooms, is when you do have that situation. Now, it raises all kind of questions. Is it too much now? Do we have to go stay in court all day? Can we have people calling you, telling you to come in? Probably not. And the reason for that is because while that helps you on your time, it cripples the court on their time. It's always a give and take one way or the other. And it's an imperfect system, but it's better, so much better than it was just a few decades ago. There are a lot of times when I've heard people talk to me about, it's heartbreaking where people come in and say, I've had custody of this child for 6, 8, 10 years, and all of a sudden the parent got back on track, and now they have the child back, and I have no rights to see the child at all. Do you know why? Because that's the law in our state, and that's the law in most other states in this country. And if we want to change that, we're going to change literally hundreds of years of law. And the reason for that is because a parent is given paramount rights for their child. Right, wrong, or indifferent, that's the decision we made a long time ago, and that's why that happens. Now, does it make for bad decisions with kids sometimes? Sometimes it does. But in the vast majority of the cases, it does not. So you have to be careful about what you do with changing laws because of 1 or 2 remote instances, or maybe 10. I'm not saying it's just a few, but it's a small percentage of the overall what you deal with, what the courts deal with, what we deal with. And that's why this is so difficult, because there is no one size fits all. Every single one of them are different. I'll never forget, one day I walk in court and I meet my clients on the morning of their hearing. And I had, literally, they took a broom closet and turned it into an office for me. And there was this young lady sitting in the office when I walked in there that morning, and I assumed that she was a parent of a child that was there in juvenile court. And I walked in and I said, "Ma'am, you're in the wrong place because I represent the kids." And she said, "Oh, no, I'm here in court." Turns out she was 15 years old. She looked like she was about 25. And she was there. She had been picked up in a truck stop for prostitution. And she told me stories that make the hair stand up on the back of your neck. She told me about how the first time she ever got introduced to drugs, she was 10. She smoked marijuana with her father. So it's difficult. Your job is incredibly difficult. There were some breakdowns and there were some problems. You guys are addressing them, and I applaud you for that, and thank you for that. It's so important we do that. But this is a hard business to be in. I mean, it truly is. Are there abuses? Absolutely. I've seen them before. People, a child care worker comes in, they get called in on something, and a parent flips out on them because they know they're being accused of wasn't right, and the worker shows them what they can do and takes the kids. That doesn't happen near as much as it used to, but they used to refer to them as a Gestapo. But again, there are some of those instances where those kids needed to be out of that house to be protected. So the point of all of this diatribe is to tell you that this is not a perfect system, and there are lots of issues and lots of problems, but if we keep tackling them a little bit at a time like this, we're going to make it better, and that's our goal. It's never going to be perfect, but we're going to make it better. Thank you.
Thank you.
So well said and so well summarized, and from someone that you had a front row seat and you continue to. And Senator, what I kind of keep hearing from DAs is that, they're losing a lot of attrition with their staff, and it just looks like it's a continued problem at the courtroom. So, Vice Chair Barrow, the floor is yours.
Interestingly enough, I was trying to find a sheet of paper that had the mission of the department on it, because one of the things that I noticed was, and I wanted to read it verbatim as it was listed on the website, was about the safety and well-being of the child. Then it goes into the family and some other things that it said. And I heard my colleague, Senator Luno, and that may be something that we may need to look at changing at this point, in my opinion, and that could be a deeper dive of a conversation that we can have, because things have changed a lot from probably when the department was created and when we started this work, as it relates to, it appears that the primary focus is always initially to reunify the child back with the parent. It's almost like, as I have met many of the workers, that's the first thing they say. And I challenge that, in that if you've never been, I know it is, but it may need to be changed. If you have never been, how can you reunify something that's never been unified? That's number one. That was one of my questions. And always, it's not always necessarily maybe the best thing, but if that is, because it's the law, and maybe that's how it's being trained, how the staff is being trained, then it doesn't open them up to see if that's maybe, and this is just me, and I look forward to additional conversations, it may not open them up to look at seeing whether or not that is the best option for the child. I recall, because I worked for a counselor before I was elected, who was actually a counselor for DCFS. And her job was to actually counsel the parents to look at the reunification of the family. And I remember there were several cases, and I remember the children's name, parents' name, and this has been over 25 years ago. But I saw some horrific things, and I remember one specific case where the counselor wrote back and told the department that she did not believe that it was in the best interest of the child to be reunified with the mother. There was some prostitution going on, child had been sold, etc. 25 years ago. The department, however, did not accept that advice. The family ended back in counseling, and she sent back the same information. Now, the child never did come back. We never found out what happened to the child after that point. But ironically enough, I saw the mother 2-3 months ago still doing the same thing. And I often wonder what happened to the child. So I bring that up to say that, and I think that we may need to look at changing the law in that we look at what's in the best interest of the child, and that the child is actually given an opportunity, regardless of age, to be able to really speak on their behalf, especially if they're receiving all the proper support, counseling, etc., to weigh in as it relates to their particular case. I just wanted to bring that up because I think we look at reunification because that is in the law, but we need to look at what's in the best interest of the child.
Yes, ma'am. Thank you so much. And I think what you're articulating is, those conversations with, about the Children's Code, with the Supreme Court, with the lawyers, with everybody that is looking, the judges, looking at where is the presumption of the law regarding parenting. There are certainly several risk factors that are so high that it would automatically not be reunification. A lot of times we have dual goals to just see which one works out. But in essence, we believe that the fabric of the society, if possible, then it is, but you can't know until you get in there. We also can't make a presumption that the allegation is right. Right? You also have to determine what actually happened, and it takes some time to make the determination about what actually happened, right? And so it's complicated, and each one of them is different.
Yes.
We're going to continue to be in the cases, in the room where those, discussions are happening. It's so much bigger than DCFS. What you're talking about, like we're talking, a lot bigger than us, and so many people sit to the table to weigh the difference between, human rights, parental rights, children, all those things, and how they come out. What I love about you is that you remember the child 25 years ago and all that stuff. So thank you for being that person who looks at longitudinal data, right, and has questions that lend us to having the right conversations. So we're going to continue to have them with you. It's not just the law. The federal rules also have something to say about how you go in, when the risk factors, basically automatically trigger, take them out. Like, this is not something that you look back on if it was like horrific abuse that you are able to immediately determine. But then there's all the other thing that's not that. Yeah. That you don't know exactly what happened. So thank you for articulating it. We're going to keep being in the conversations with you about it.
And I appreciate that. And one thing I would bring up, because recently there were some data about the number of children getting hold of drugs and how that number has skyrocketed, and the number of kids that have died as a result of drugs. I mean, it was on the national news and the national stage, and I mean, the number was astounding. I think it was 1300% increase. In less than a decade or something like that. I mean, the number is staggering.
It's terrifying.
And because of that, I think it warrants that we look at it differently. And I guess my question, and I appreciate that, but my question is, how does the workers, do they go in automatically with the mindset of thinking, my main goal is to do this, when it should be more open and a lot broader? And I don't know, but that's a conversation I would like to have, and maybe even with some of your staffers in terms of how they view cases, because you bring up a very good point, and I remember those days in terms of going into court with the counselor and just being there, right, and watching how fast things were going through and how things were happening. But I would say in my particular case, I saw where they gave real attention to the details of what was happening and really read through the information.
Yeah.
And I have a great appreciation for that. But I don't know if it happens in all cases.
I will tell you, it's one of the main reasons that we are likely going to need more, like, we're making the case for more case workers. The more time you have with the case, the more clearly you can get in and do work with families, do work with the kids, talk to another collateral, outside of what is mandated, but like what could be really good, find services for people. I mean, the more time you have to do case management, the better work you're going to do. And so it's one of the reasons why we're trying to use this tool to help make the case, to help you guys understand if we're going to stick to a caseload standard because it's for the best outcomes in the system, then let's actually all be looking at, like, what does it take to actually keep up with what we have now. I think that we can get into some places of determining what can we do when we find that there is substance abuse. There's research that basically tells us that if somebody is using, if they're addicted, it's not just, oh, they're addicted to drugs. Like, no, it's a disease. And actually, to actually get on the other side of it, it requires a lot of intervention. Do we set something up? And I think that's a good conversation as far as to have. It's public health, it's mental health, it's determine whether we have enough services in Louisiana that can actually rise to the rising cases and those types of things.
And you bring up a whole nother situation. Because I see that you guys here kind of answer some of the questions from our last meeting, which I appreciate. So out of the sake of time, Mr. Chairman, I won't go through all of that, but MCOs was one of the things that I did want to ask about.
Thank you.
And the role that, have y'all been able to make that connection and the role that they play, especially as it relates to our Medicaid population and our children?
We are having the best conversations right now.
Okay.
And actually, we kept on, I kept on, like, please stay with me and help me work through this. Our former, now retired Assistant Secretary Renda Hodnett is helping me to continue working directly with LDH and all their players. So we're learning things that we didn't know before, and we're seeing where there has been some process problems of understanding all that Medicaid brings to the table, actually making it all the way to the worker, that information. How do we really make that actionable for the workers? So that's the work that we're doing right now, even some determination as to whether or not should DCFS have a medical director. We're actually looking at that right now with LDH and talking through that with some of our partners. And so it's very, very good right now, this learning that we're doing with them to crosswalk into our actual work. How does this translate to a worker working with a family who has Medicaid?
So this is not an additional cost that we're having to take on. This is something that's already a part of the plan, right?
Correct.
Yeah.
So far, that's the case.
Okay.
Yes, ma'am.
Thank you, Mr. Chairman.
Very good, and I know that was something that the committee brought out, and we appreciate y'all doing that. So just to kind of recap, the board is clear right now, and why don't we do this? Why don't we hit the highlights of, I reviewed in detail kind of where you have some updates made, and that's this sheet here that has the updates, and I think that's your key presentation is the updates. And then I saw
Relates to the red on the...
Right,
Yeah,
right.
so
So-
everything in red means we shifted it a little.
and everything else seems like it's gone according to schedule.
That's right.
So what I was thinking is we go through the 7 disciplines, hit the highlights, and some of it is just some date changes or some rescheduling. And then once we finish that, why don't we go through the performance audit that was requested by Senator Boudreaux and Senator Barrow as far as the vehicles, and I see there's a spreadsheet also that tells you what's going on in each region and the whole vehicle count. So why don't we go through that, and then Representative Turner, after that, we'll bring up your folks for some testimony once the committee questions it. So why don't we hit the high points? And as we do, if I see the board clear, we'll go to number 2. If it's clear, we'll go to number 3.
Certainly.
Is that fair with everybody? Okay, let's go.
So goal number 1 is to recruit and retain staff and foster caregivers, and I think you're probably largely aware of everything we're doing in this bucket. There's a lot of recruitment and retention efforts through the hiring fairs, through pay incentives, through bringing more people in early, through university partnerships. As Secretary Ricks said, the closer tracking of caseloads and our staff and attrition and what do we really need to be fully staffed. So that makes up the bulk of the first section, except that, and of course the inclusion and belonging work, which we're excited about what's to come from there. The second piece of that bucket is about our support and recruitment of foster caregivers. And this is a bucket that's really near and dear to me as a former foster parent. And so the biggest thing I want to point out there too, I guess 2 things. One is our Foster Caregiver Advisory Board that's really getting underway. It started last summer, and we will be next month launching the subcommittees of that body, which allow a much broader group of foster caregivers to come to the table shoulder to shoulder with us and talk about solutions. Where are your pain points? We've surveyed a lot of foster parents. Where are your pain points? What do you see as opportunities for us? And let's have that conversation. And so that group is meeting every other month. And then the second piece is recruitment. So we have a national expert that we're working with, and then we have now someone whose role is really recruitment on our staff that's working with the individual regions to say what specifically do we need here in terms of foster caregivers, and all of that work is rolling out heavily right now. So I'll pause right there for that. Obviously, I left out a lot of things, but I know we don't want to go point by point.
The board is clear. The only thing, just give us a refresher course real quick on your signing an MOU on 2B, sign an MOU with memorandum of understanding with local partners for EBR pilot. Tell us, refresh our memory on that, because y'all reviewed it, but I'm kind of vague on it.
Sure, so that's the child protection model. And so when you think about, we've just talked about the complexity of this work, right? And when you think about us needing our staff to have all of the expertise and the training of a fully seasoned nurse and law enforcement officer and substance abuse counselor and all of that, we can't get there, right? And so we really need community partnerships at the table with us looking at particular cases. So this is a pilot in East Baton Rouge where we're working with a group of partners, including law enforcement, the Family Justice Center, I'm sure I'm leaving out several of them, to figure out how, for particular cases, how do we do this work together? And so we've been meeting with that group for a while now. As you see, it goes back to September, but now we're at the point of forming that charter agreement that says this is what we do and this is how we operate as a collective group.
Very good. Any committee members have anything on section 1? Then why don't we go to 2?
Okay, so 2 is multidisciplinary response with key partners. So that is that child protection model and our solidifying our relationships with law enforcement. That's a critical piece of the work that we do. And so we've had some of our leadership team travel the state recently and meet with the regions, with the local law enforcement entities, with our CACs, to really make sure that our partnership agreements are fresh. And so that work has happened really in this last quarter. You know that we modified our policy for medical reporters. We've talked about that, and we've continued to check in and make some adjustments on that process. But this is the community partnership piece, I think, is a big priority for us moving forward, even outside of these 7 strategies, of how do we have all the right people at the table with us to make sure that comprehensively, from that primary prevention perspective all the way to the intervention perspective, we're all serving families.
We do have a question. Madam Vice Chair.
Mr. Chairman, I hate to do this, but I need to go back to the first one. The signed MOUs with the local partners from EBR pilot program. Who are they?
I will not be able to speak to them specifically, but we can have someone come up and do that.
Okay, because I'd like to know who they are and what's their role exactly. Sorry.
Oh, no, that's good.
No, great question. And of course, it starts with law enforcement, but let's have Mona come up.
Good afternoon, Mona Michele, Department of Children and Family Services. So the partners in the child protection team include the Assistant District Attorney in the District Attorney's Office, the local Child Advocacy Center, Baton Rouge Sheriff's Office, East Baton Rouge Parish Sheriff's Office, and BRPD, as well as the staff of the Family Justice Center, which is located on Government Street within Baton Rouge.
And so tell me, what exactly are they doing? They're coming together, and what are they doing?
So we just met this morning. It really is coming together to look at, okay, how can we all be better partners to look at what information we can share. Co-housing staff, we have moved some of our staff to the facility at Family Justice Centers where there is also presence of Baton Rouge Police Department, where we can build better relationships, go down the hall and say, hey, do you have this case? I have this case. And then looking at any breakdowns in processes to see what are some of those barriers, what can we do as a collective group to address them, and then work collectively to address the needs of children and families.
So they all kind of like housed in the same locality, which that helps a lot. But in terms of technology, how is that coming into play at all in terms of being able to communicate and then people can see before they maybe meet the technology piece? Has that come online yet, or okay?
Not exactly sure which you're thinking through. I think one of the things for us is that we want to be able to understand a household better before we go out, and it would be good if we could see if there's risk in that household because of law involvement. And so we don't have the ability to literally share that at this time, but we're hoping that co-location will allow us to stop at the desk and say, can you check this address?
Okay.
Or once we find out a little bit more, are we able to figure out, like, has law enforcement been at this address before? You might remember that could have added some extra information to us in some cases.
Right.
That will allow us to understand the risk a little bit more.
So I can go by and visit and see that actual site?
Yes,
Okay.
yes, you can. It's the Family Justice Center component of it, and then we meet on a weekly basis on Wednesday mornings.
Okay.
And so if you'd like for me to send you the invite to the next meeting, we'd love to have you.
I would
join
love to
us.
be there. Okay, thank you. Thank you, Mr. Chairman.
Oh, thank you. Okay, so we'll continue on item 2. Anything else you see on that?
Any other questions about item 2? Okay, well, we'll go on to item 3 is prioritize high-risk infants and toddlers. This is where you see a lot of community partnerships come into play. So when you look at the nurses that we've talked about before with you, who we're in a pilot where we have nurses working with us in Baton Rouge, particularly around substance-exposed newborns. This is also where you see Child First and Intercept, which are 2 of the programs that are through the new the funding that Secretary Ricks talked about, the Family First Prevention Services Act at the federal level. That'll bring stronger services to our families. And then Family Service of Greater Baton Rouge. This was an opportunity for us to talk about how do we, if we have community partners who do intense work with families, can we partner for our families that are receiving in-home services? And so that's a new initiative that we've just started. And then My Community Cares. So that is our best picture of true primary prevention, neighborhood level prevention efforts where we help families find the resources that they need before they come to the attention of the Child Welfare Department. And that work is expanding now statewide. It was a pilot in a couple of areas before through our family resource centers. And that work is also started rolling out in the fall. And then the last one, I think, in this bucket is really where we would love to be, where we talk about these families, these reports that come in that don't meet the criteria for us to investigate, but clearly we know that this is probably a family that's in need of services. How do we connect them to resources? And it's a much more complicated bucket of work than what I just described. And so it's an area that we're looking at with Casey Family Programs too, and their work with us to figure out maybe how can we have an opportunity in there for some prevention work.
Do you have any, I see on just a couple of them there's maybe contract delays. As we worked with civil service and they came to the table, are you having any issues with procurement or any of the administrative functions,
really
or it's
not.
just negotiations?
They have been fantastic.
Yeah.
They have worked so closely with us. Yet most of the contract delays we've had have just been about negotiating scopes of work, like us and the vendor figuring out how to do our work differently. This is a major shift for some things for us. And so it's really about, let's make sure that we do a thorough job of figuring out all the I's that need to be dotted and T's that need to be crossed before we take on this work.
Understood. And as Senator Boudreaux and Senator Barrow have so many times said that they sit on Senate Finance, as you're expanding the services that we're asking for, and we're asking for just a better maybe model we've all talked about, how is it impacting your budget for the whole fiscal year? Do you see that there's going to be some budgetary challenges as you're ramping more people up and more training and added contracts and pilot programs? How's your year going to end?
Yeah, so we've been having these conversations with the commissioner, and I welcome the undersecretary to come up if you'd like to talk about it. But the majority of things that have to do with staff, it's the vacancies basically are funding the new staff things. But to the extent that we get to the point where we realize that it is more, we're keeping in lockstep with the commissioner's office to bring those things to bear. I think Eric has been holding some numbers as we've been adding some of these contracts.
So I guess what I'm saying is, if you hit some of these goals, how will it affect kind of your budgetary financial look?
Good afternoon. Eric Oran, DCFS. So far, I can tell you, we're running a report at the end of every month. We have a code, a financial code, for that. We have spent an extra $3.5 million just on this project that we have here. Most of that is on personal services, so salaries, for employees. Because of the vacancies we have, that aspect of it, we should be covered for the year. I mean, unfortunately, we have high vacancy rates, so
right.
That allows us to actually cover this extra cost associated with salaries. The contracts is really, I think we mentioned last time, there's some pretty heavy contract associated with like the 24/7, CPS and things like that. That has not been fully implemented yet. So it's not hitting us very hard. So we're keeping track of that. That's where we could have, if it's being implemented and ramped up toward the end of the year, we may have some extra cost. But so far, I would say we're okay.
Well, terrific.
Like if we turn to 24/7, that contract is like almost ready to go out. It's basically going to hit us for a quarter, right? Basically a quarter, 4 months of the year. Likely something we could absorb if it's a short period of time, but working with you guys on making sure that we get budgeted for the following year is where we'll be looking to make sure. But we're really working alongside with the commissioner with that, looking at, like Eric said, monthly to make sure that we're not running into the red.
Very good, because I know having two Senate Finance members next to me, they'll understand the issues when it comes to the money. Just for a quick second, I did want to open it up for the Vice Chair.
Thank you, Mr. Chairman, and you did hit the nail on the head. That was definitely one of the questions I had listed in terms of if you guys was going to need any additional funding. Did you need to, ask for more money to finish out this fiscal year? But at this point, because of the vacancies, although now we're having a fair, so help me with that. So as you are hiring more people, you still believe that there's going to be enough funding left to actually substantiate the programs that you're adding?
So far, what I really would love is to run into the red and come back and tell you I had so many people that we hired that we're going to need a little bit more money to make it to the end of the year, but we're not there yet. And I think, in the end, this ramp up rate, like, it still takes, if we hire you, if we give you a conditional offer, it's going to take about 4 or 5 weeks for you to actually come on board, right? So even the ones that we're having next week, you're still looking at 1 quarter, right? Paying for that seat for like 1 quarter. We're running in here to tell you the biggest impact on our next year's budget, our biggest request is actually going to be in being able to help you see where we need more caseworkers,
Okay.
more people to work those cases based on the high levels. So, and we're not going to make, we're working with the commissioner's office to make a request that makes sense to people, business case, data, et cetera. So we're not just going to throw something out there right now.
Okay, all right. And then I guess my last question would be, and I see Mr. Decato is here, we running up on a deadline on the additional funding that may be needed for the plus up.
We actually needed from civil service to extend some of the temporary measures that they gave us. And in keeping with Mr. Decato's support, we also have had the Civil Service Board support. So last week we had 3 measures. All 3 of them were extended.
Good.
And other things that Byron can do has been super helpful with us. I think one of the things that Amanda and I have been doing, particularly working with Casey Family Program, is to really review the structure of child welfare, like the structural impacts, like what do we need today that we might not have needed 20 years ago? Like, how do we need to really review some things? And so that work, we'll be bringing that work to you once we kind of finalize it, so you can see where we are on that. But civil service has been very, very supportive, and the commission allowed us to extend those temporary measures for a few more months, I think it's August or October, so that we can continue this deeper work to see if we
Good.
can shore up the actual structure itself.
Okay, that is good to hear.
Yes.
Okay, thank you.
So I think we almost knocked out 3, huh?
I think we did.
I think so. So section 4.
So 4 is about coordinating with the managed care organizations. That's really the work that Dr. Hodnett is doing with us, and that we're in lockstep with LDH trying to figure out.
All green, you see? It's all green.
And so from when we first heard it, and the whole committee got sticker shock because we've heard about the MCO issue, it doesn't look like a new contract will be needed. It looks like it's just kind of a cooperation between DCFS, LDH, and also the managed care organization.
Yeah, at this point, we haven't identified a need, and we're recognizing there's some things in the MCO contract that we just weren't aware of.
Gotcha.
And so the exercise is probably like, what issue you're solving for is allowing us to get a whole much more information than we had. So it's possible that there's something that we need to add on, but we would bring it back to you like we said we would.
Well, terrific. I want to commend y'all, but I also want to commend the committee, because I think each and every one of y'all came off the table, including our Senate staff, like, oh, no, we don't need another contract. We're paying enough for this. We need to get what we bought. So that's terrific. I commend the committee and staff on that one. Okay, so we'll go to number 5.
Number 5 is enhanced training and coaching of staff, and really kind of the heart of this is evaluating our policies. Do we have good policies? Have we had national experts come in and look at our policies and help us see where we could make improvement there? And then now, how do we coach and train staff to live within those policies? How do we reinforce some key things about safety and other areas? And so that is all on track, and we're learning a lot in small pockets of work about how we can replicate those things statewide. And then the Policy Academy, which is the last one on this page, is also really exciting work for us, because this is in partnership with LDH. They applied with us as a partner for this National Center on Substance Abuse and Child Welfare Academy to really look at specifically families with substance exposed issues and families with substance exposed newborns, and how we can do that work better, and how we can go more upstream and look at, do we have opportunities prenatally to connect families to services, and how do we really wrap our heads around this issue, whether it is a child welfare need or a child welfare approach with a family, or it is not a child welfare approach. It's a community approach, or a LDH, or a hospital system approach. So we're getting into the thick of that work this month with the Policy Academy.
So just help us on the last page on 7 that says that this is going to be a February goal: explore need for additional training in drugs, domestic violence, substance abuse, mental health. Tell us about that task force and what they'll be reporting back, or what's their mission?
And the only reason that's February is because when everything is a priority, nothing is a priority, right? So we had to push some things a little bit further, but it was like, what are the really, we really need our caseworkers to be specialists in so many things. And so a lot of that training is already a part of the regular training that they get through new worker orientation or through ongoing training. But this is an opportunity for us to stop and say, what is missing? Is there anything that we're really experiencing now that we need to beef up, and utilize a community partner to come in and help build our expertise in that.
Very good, very good. Let's see, Madam Vice Chair, it's all yours.
Yes, I think this might be my last question as it relates to this. There are a number of organizations or partners that you guys have connected with. If y'all can give us a list of all of those partners and what their responsibilities and roles are, I know I would love to see that. And then under the former secretary, she started a program with the children who are in the foster care system. I think it was called LEAF or something to that effect. Is that still in existence? Are they meeting and are they playing a role in some of the work that's happening now?
They are meeting, and if we need to get into specifics, I'll have to call somebody else to the table. But they are meeting. They are meeting regularly, and they, in fact, even recently, they expressed interest in how do we at some point come together with the LEAF board and the Foster Caregiver Advisory Board. You know, how can we take all of the people with lived experience in our system and make sure that we're all looking at some of the same issues together.
When you guys come back next time, I'd like to hear more about that, because I believe that their experience is so valuable and so important, and having them as a part of this discussion and being a part of us would be real important, because they have been in it.
Yeah. So I think this is important, though. So Amanda and I were talking about this last week of, you know, we have the foster care givers giving us information back, and then we have extended foster care giving us information back, and then we have, like, we need to be in the same place so they can say, oh yeah, and that's how that impacted me, right? And that includes the employees, right? The frontline case workers, recognizing that. And so many times over the past few weeks when we're having a discussion about something, we're mandating that all the way through, like, bring the caseworkers to the table so we can get their input on this. What do they need? You know, we were having conversations with OTS and Deloitte about immediate changes to our access system that will allow us to have some immediate benefit for the workers. And we're like, we're not just going to have the managers talk about it, we're going to have the people that are using the system at the table. And it's a short period of time, but it's a very valuable period of time to get them out of the field and helping with understanding the decisions that are going to impact the way they actually do their work. So this lived experience and bringing lived experience to the table at all levels is important, and it's also a part of our belonging work. I know we talk about that, you don't know exactly what is that like. It is about the things that people complain about. It's about, why does a worker talk to somebody like that? That's an issue of not respecting someone or not understanding. It's an issue of understanding empathy. That's a stated goal in the training. It's an issue of understanding, putting yourself in somebody else's shoes, emotional intelligence, right? It's understanding it from multiple perspectives, but it's also having lived experience at the table where you're not trying to make a determination on your own what somebody might think, right? That's why it's so valuable when people are sending information. It's like, this is my experience. I believe you. Now, let's kind of put it all together in one place and see the different layers and why, from different perspectives, the same problem looks a little bit different, right? So we want to keep doing that. And Lacey DeSherry, who we brought on to the office, to our staff to help us with the belonging training, is also a scholar in lived experience, a former foster child, who brings her lived experience and her education and research to the table. So we'll be able to capitalize on that, to do more of this. Nothing about us without us, right? Making layers of input, more diverse perspectives on the same issue. It can't just be about the staff. It can't just be about the foster parents. It can't just be about the parents. It can't just be about what the child wants. It has to be all of those things together, right? It's a complicated system. But we're like you when you say, I'm not afraid of big things or hard conversations. That's what we do all day, right? So we just need to make sure we do it better, right? And so bringing the lived experience along with us is super important.
That's good. Deloitte, you mentioned them. Were they able to answer your requests, and have they been able to actually make the technology piece a little bit better for the workers?
Yeah, so we are currently building, working with them to prioritize what's going to roll out what and where. Did I tell y'all? I can't remember the timeline, but they actually sent somebody in and did a ride along with us. Some of their staff rode along with our staff to understand how they actually interact with the system, and they came back with 2 pages of, oh my God, I didn't know that worked like that, and started helping us. And so Mona, who was sitting here, has been working with them and bringing that, like I said, the caseworker that they rode along with. That was a very interesting day. The ride along went some kind of way, but anyway, I was like, well, they got a full day of understanding what's going on in the department. But so
Maybe
yes,
we need to have that happen more often.
more ride-alongs.
Yeah, that's right.
We can
So they
do
can
it.
have a better understanding.
Better
of-
understanding.
That's right. In
We're certainly
complexity,
open
that's
to
right.
that. And
Yeah.
actually, walking a mile in somebody's shoes actually goes a long, long way
They
of
get paid enough
understanding
money.
it. 100%.
Uh-huh. Lastly, the 24-hour worker program y'all was considering, or after hour, did you implement that?
This
Did y'all
is a
start it?
24/7 contract that is about to be approved at some
Okay.
point. So we did hold it up. It was to go for approval.
Okay.
We pulled it back and made sure that the contractor wouldn't be trying to hire our people
Okay.
from us,
Okay.
because that would be,
Yeah. Yes.
yeah.
Yes.
So we pulled it back on purpose. It took a little bit longer because we put that in there, and it's literally to be approved in the next couple of days. But we've already started, doing some training with the staff that will be working on that. But I'm so excited about being able to bring that back, to hear the voice of both those we serve and our employees as to whether or not that is super helpful. They're still going to have to hand that case back to a worker right in the morning. But if the worker can go home and go to the soccer game for their own child, I'm going to have a much happier employee.
Yeah. Yes. And I will say, as I think this is, for me, I think I'm finished. Some of your staff that I have met, and the level of loyalty and commitment that they have, and working those long hours to 10, because when we left, they weren't finished. They still were not finished at 9. They were not finished. There were 2 other cases at least behind. And then to have to start all over again is just too much. And nobody can consistently continue to work at that level and be effective. And what we're asking them to do is just absolutely not fair. So I'm looking forward to see how that works. And I pray that it works well.
Thank you.
Thank you.
Well, I
think I'm finished.
Oh, you good.
I've just gotten word from behind me that the contract was approved.
The contract was approved. So we are launched.
Look at the committee work. Look at our committee work. Look at us.
Y'all are so effective.
Look at us. They just heard us and they signed the contract. Senator Pope, all yours.
Thank you, Mr. Chairman. We started out, Amanda, with going down a river. 3 parts to it, I believe, wasn't it?
Right.
I don't know where we are now. We may be in an ocean. But I'm going to make I'm just going to make a suggestion. I'm not even going to put it in the form of a request or whatever. What you may need to do is get us 9 life preservers up here before we jump off in that river. I do want to appreciate your report. And if it's okay, can I use your analogy in a future thing that I want to do?
You can, and I will happily give you the much more dramatic version of that story offline.
I think I've had enough. Thank you.
Don't give him too much, please. Okay, so we finished 5, right?
We did.
Okay, so we're on 6.
So 6 is improving safety decision-making and intensive oversight of complex cases. What I think the short answer here is the CCDM, centralized consultant decision-making, is something that we started probably about knocking on a year ago. It is a model that really will allow staff, whenever they've done an investigation and they've determined that it's invalid and the child is safe, that they can call a pool of supervisors to staff the case and do the paperwork to close it out, so that their time can better be spent and their supervisor's time can better be spent on the cases that need their attention. And so that's started in a couple of spots, and we're moving into the full statewide expansion.
Very good. And it looks like on 7, you're on track for everything on 7.
And 7 is one that I'll just say, we'll put a pin in it a little bit, because I think this may shift in our deeper work with Casey Family Programs, and we're looking forward to diving into that
Okay,
within.
very good. The board is clear. You want to go over a little bit about the vehicle request that Senator Boudreaux and Senator Barrow talked about from a standpoint of, I see you have a legislative report that is dated January the 20th, 2023, so I guess it's so hot off the press it hasn't been released yet.
Well, that's funny. So I don't know if the oh, there they are. I thought I saw you earlier. I'm gonna let her give you all the news on this.
I wish this was the stock market report. I could make some
let
money.
me explain that. Good afternoon, Emily Dixon with Legislative Auditor's Office. We were asked to do this for the JLCB committee meeting, which is scheduled tentatively for the 20th, so that's why that is dated. Then yesterday I talked to Brandy, and she requested that we send it to you all for today, since this is where the discussion came up, so forgive the future date there. So what we did is we worked with the department to just gather some information as requested at the December meeting of this committee regarding the fleet and the travel policies of DCFS. And the question was asked, how many cars does the agency have available? How many employees does it have that are required to drive as part of their normal daily duties? And the department reported that as of, I think it was late December, 982 employees, but only 172 vehicles. And those are spread out across the state through the various parish and regional offices. There's a spreadsheet they provided in your packet, too, that breaks it down by office, by how many employees are assigned to that office that are required to drive, and then how many available vehicles there are. So that, we did a little math, it averages out to about 28% of employees with a car. They're not dedicated to particular employees, so they're 28% available. Our question came up, how does that compare to other state agencies in Louisiana? And then how does that compare to other child welfare agencies in different states? So we don't know at this point. We are planning on doing a full-blown performance audit on fleets across state agencies in Louisiana. So that will look at vehicle usage, not just within the department, but across the state, because there may be agencies out there with vehicles that aren't being used to their full capacity. So we'll get data from LPAA, miles driven, number of cars assigned, that sort of thing. So stay tuned. That's
But thank you all for being proactive, when it was brought up. The 99 miles, as far as that is concerned, that's system-wide throughout the departments?
That's throughout the state.
Throughout the state.
Through the state. That's a division administration policy, PPM 49, I believe. So that requires the employee is supposed to try to use a state vehicle if one is available. Then if not, go to a rental vehicle if one is available, and they can go to either Enterprise, Hertz, or National, I believe.
That's become a challenge, is rental cars. It seems like that's not cost efficient.
And that's something that we'll also look at, too, because you brought that up on number 7 on the page 3. We just did a quick look at some other states to see if they have similar requirements. And we just looked at Texas and Mississippi real quick, and they're only required to use if a rental car is more cost efficient than using their own personal vehicle or a state vehicle. So they did. The numbers presented and this was based on 2023 new vehicles at approximately $27,000 a car. If they needed 810 more vehicles, it'd be $22 million. Now, of course, as you've heard, they're wanting to expand their staff even more, so that would bring the cost up to approximately $25 million. Sorry.
There's 4 wheels on a car for $27,000?
Sorry.
There's actually 4 wheels.
Well, I'm sure those are not, Well, and then also you need to factor in insurance, gas, maintenance, which they approximated to be about $350 per month per vehicle. Other items to come up to consider is that they need to have additional staff to manage an
A fleet
additional
of
size
workers, yeah,
fleet.
yeah.
You know, the maintenance, the
Yeah.
usage of that, and parking. Right now, state employees or child welfare employees don't meet the criteria to be able to keep vehicles at their own personal home overnight, so they'd have to return the vehicles to their local office. And parking right now is not sufficient for additional fleet. So there's other factors to consider too.
Very thorough report. Senator Boudreaux?
Yeah, thank you, Mr. Chairman. I too want to express my gratitude for the quick turnaround on some of this. And as I read it, as she said, it brought up even more questions. And what I'd like, if we can get some help from the staff to, of course, joint budget is going to get this, and nothing's going to happen at the next meeting. But I would like to set up something with Commissioner Darden. And while we're not going to have a request for $22 million more in, I think because we have focused on what's the problem and who actually needs them, and in reading it, I came across the fact that it is the PPM that stipulates what's what. I would like some discussion as to how, even if it's for a temporary period of time, or if it's a couple of years, to take or carve out that section of the agency to accommodate those needs, and not blow up the whole policy for the other agencies. But we've been here, and we're going to continue to discuss how do we fix it. And while we might not be able to knock everything out, some of these small steps will go a long way in trying to, first of all, tell our employees we hear you. And it's quite clear with some of those comments, and then looking at what Texas does and some of the other states. So if we can prepare a letter to the commissioner, I'd like his input as to some of the quick fixes and what would they entertain as far as some of these requests. We don't have all of the positions filled, so we're not going to get those cars, and we are talking about expanding. But I think if we can just phase some of these things in, but I think we're limited on policy for number one because they prohibit it, and then we need to start now looking at when we do get these extra vehicles, where we're going to park them. And I noticed in one of the paragraphs about a fleet maintenance manager. So what I don't want us to do is to get into we're dealing with children and family services, and I don't want to confuse it or conflict it in any way with having to bring on a fleet manager, which, if we can, somebody's going to have to quarterback this, where we're going to have to borrow from Peter to pay Paul. We can't spend any more money outside of what the objective of why we're meeting today is, and that's to do a better job and getting our arms around this. And I don't want people to sit at the table and say, we're going to have to hire somebody for $48,000 to manage that fleet. I would hope through the Division of Administration, whoever's handling the fleet can pick up the tab and add whatever number of vehicles we're doing. And I'm not, again, advocating that we do all of this overnight, but I would like some dialogue and some discussion to begin, because it's going to take that. And parking, we might have to park 2 blocks instead of on property. But we need to start looking at those things, and that's what I would like that conversation to begin. So when we do get down to April and May and we're into the budget, we'll have a realistic idea of what we can handle, and we'll at that time, Madam Secretary, we'll know where we are, and as we continue to track with new employees coming on, and we could realistically see what is it we could take on. But I do want to thank you and the team for being here at the last meeting and listening, and for providing these. It's just it brings a little more complexity to trying to get it done. But we as we said earlier, we're willing to handle all of those if the outcomes will help those people who are sitting behind us, behind you all, and the children of this state. Thank you.
Thank you. Thank you. Well said. Senator Barrow?
Really quickly, and I certainly echo all the comments of Senator Boudreaux. I do want to thank you guys as well. I really do appreciate all the work that the Legislative Auditor's Office has been doing across the board, not just in this area, but in so many things. I have been so on the spot, and I greatly appreciate it. Madam Secretary, I would ask, as we are kind of exploring this, and maybe this could be something that's added, Senator Boudreaux, because I am deeply concerned, still troubled by the fact that DCFS workers are having to use their own vehicle. That to me gives me a level of discomfort. And as it relates to liability issues, things of that sort, I'm assuming, I hope that we really haven't had any, but I hope that we're trying to move away from that altogether. Because I just don't believe that a worker should be using their own car to transport children, and I don't know where we are with that and if that's even plausible, but I am concerned about that. That just, to me, is such a huge liability issue.
Yes, ma'am. So this whole discussion is really about that, right? There's always going to be three options, right? A state-owned car, a rental car, or your own car.
Mm-hmm.
And the way that it's set up is that's the last choice. But when we go back and we start talking about, you know, what rental car place is there in Irwinville, Louisiana, right? If somebody lives there, or in, you know, they had to come into Baton Rouge to get a car so they can go to New Roads to do a case, right? And so it is complicated, and without dedicated cars, you end up, you know, in these situations. So there's a couple of things that have happened.
Okay.
So I think that it's important to know that we're not requiring somebody to use their car. We're allowing someone to use their car if there's no state car available and there's no rental available. It's an allowance, it's not a mandate.
Mm-hmm.
So we've done a couple things, and the division has been working with us along the way at different times. Like during COVID, they actually gave us an exemption to the 99-mile rule. So that's something that we can look at. It's always like they want to look at it, and then you want, when you have an exemption, you want to start it and you want to end it, right? And so it doesn't last all the time, but we have been there before where they have given us the approval. We also have to make sure that we're holding ourselves accountable. Are we making sure that people are turning in mileage that makes sense, which really does end up meaning you got to have more administrative persons to help with those things. And it's also very difficult sometimes for people to get reimbursements back. And so that goes into the many cuts that we've had over the years are not just in programs, but it's also in our fiscal staff. And our administrative services staff is also tiny compared to what it was under Governor Blanco, for example. So I don't like people using their cars either for multiple reasons, including how long it'll take them to get their 90 miles that they drove back, right, in a reimbursement. And when we're talking about real time, real talk. So we just had an organization help us with a Lean Six Sigma project to determine how long does it take to get your reimbursement back. And this is not like most agencies where their reimbursements are tied to, like, I went to a conference. No, this is everyday work. And if I'm turning in mileage, it's going to take me some time to get it back. Something that was bad when we got here, and unfortunately it's still bad, so we're working on that right now. And it's a thing, and it's one of those things where, how do I tell my employees that I respect them if I don't get them their reimbursement for 3 months?
Yeah, which I know has been an issue, but I guess I was thinking along the lines with the rental companies. If we could kind of have like a designated car, like
we do that. We get long-term rentals sometimes. We can like get them for a month, and we put it in the fleet like it's just one of our fleet cars. But it still takes somebody to go get it. You've been to rental car? You're never going in there to pick it up. Whatever you ordered is never there. You're waiting for it to come out. You know what I mean? And so it takes time to put in to go get the rental, but we do it. And we do it for long-term rentals at some points to put them on site. So then you'll have, you know, different issues. And Eric, the Undersecretary, Dr. Horn, has run some numbers to look at our use levels in for the rental cars. Sometimes they give us good data back. sometimes they don't, right? That contract with Enterprise, for example. So we can cut it lots of different ways. We can sit down with whoever may be most interested to see it in different ways. We can bring you back spreadsheets. But the division has been working with us to try to accommodate us. I think it would be bad for me not to make sure that we're stating that. It's still hard, and it's still difficult, and it still takes time to have to go procure or secure a vehicle that's not just one of the ones that's sitting on site. So that's where you end up in sometimes having people use the car that they came in with to go someplace because otherwise it would take you too long to get one, or Enterprise is out of cars. I mean, that happens too, right? So it is the third choice: state car, rental car. Hopefully we have a long-term rental on site. But as you can see, the number of staff that's actually using them is way higher than those that's available, and that would also oversubscribe those that we bring on as long-term rentals too. So, it's not the first choice, but it does happen sometimes.
Yeah, and I understand. I guess as you are sending the letter to the administration and they're taking a look at it, I'm thinking about those areas where you don't have the rental car, right?
Yeah.
But we have a agreement where there's one to station there, so that way the employee does not have to use their own car. They can use the rental car instead, and maybe it can be some kind of agreement. And that won't be across it won't be all the parishes, but it would be just certain areas maybe where we can kind of cut that down. I'm concerned, of course, about people being reimbursed, but I'm concerned more about other liability issues.
Of course,
yeah,
absolutely.
Yeah. Okay. All right.
Yes, ma'am. Thank you.
Good discussion.
And when we made the determination as to which offices, which cars would sit in which offices, we did that with some indicator as to how far away from a rental that office is, right? So when we allocated the cars, that had something to do with how we allocated them.
Very good. And once again, we want to thank your team for being so responsive. So yeah, everybody, the board is clear. You had anything, Tax? Ms. Peck, Ms. Cannon, anything we didn't bring out from our to-do list that y'all should bring out? So we do have some public testimony. I know Representative Turner, this is, if any of his constituents want to know, this is his third committee meeting today to attend. So I want to thank him, but I think no, we're going to give him one per diem. So, Representative Turner, if you want to bring your constituents over from Ponchatoula and from Donaldsonville, we'd love to. Downsville.
This is Ruston now.
Oh, it's Rust. Okay, I'm sorry.
Closer to Arkansas.
Closer to Arkansas. So we thank y'all for making this trip over and for being here. And we always want to learn because this committee takes in a lot of public comment, and we always want to learn. So we want to welcome you here. Just state your name and. Representative Turner, I want to thank you for also the work you're doing. Thank you.
Hey, so I got a 30-minute little introduction I want to do.
I have a motion to adjourn by Senator Pope.
I do want to say, Mr. Chairman, committee members, thank y'all for doing this. Listening today, a lot of good information, and thank you for the work you're doing because this is something we need to do. We have a cell group in Lincoln Parish, and it covers all the high schools, juniors and seniors, and I had an opportunity to talk to them last week. And besides school lunches, this topic came up, and they asked me how to fix it. And I said community. And I brought up, when's the last time you went to your neighbor and borrowed a cup of sugar or needed your neighbor? And we have to get back to that. It takes a community to raise kids. I will say I wonder about all of y'all. She knows about lifts and pockets. She knows about drag strips and people that like to race up and down in their car. So y'all be nice to her. Okay, I'm going to let her introduce herself. So this was my 5-minute introduction.
Very good.
Introduce yourself.
Thank you.
Thank you.
I'm Christy Carter. I'm a foster parent. My husband Jason and I served in foster care for over 5 years before we took a really long break. We took 7 years off, and now we're back in foster care. We had emailed senators and representatives when we were in it before, seeing the need for change, but to no avail. But we are back in it because we want to be a part of the change. And so while I'm here, the one speaking today, thankfully to our representative, Mr. Turner, which I'm very grateful for, please know that I'm one of many foster parents that see the need for change. I just am blessed to have the privilege to be here today to be the one speaking on behalf of many foster parents. So I wanted to talk about the reasons that foster parents quit within a year or two, because we're not retaining foster parents either, as it has been said. And so, of course, one of the reasons we all know is a lack of communication and support from DCFS workers. And it is sad to say, but there are foster parents, I myself included, have been guilty of this, that we have a list of workers we will not take a case from. And that is sad to say. But on the other hand, it is just like all of you have said, that you have seen lots of good workers and lots of people who are in it for the right reasons. And just like any organization, there are also people who aren't in it for the right reasons, I would say. So that is a problem. There are also, unfortunately, some of us have gotten to the point that we will ask what judge is presiding over that case, because we don't want to deal with a particular judge. That is sad. I personally have been to court on behalf of one of our foster children, wanted to speak. As I got there, the worker informed me that they had already met in chambers and that it had already been decided what was going to happen. And I'm like, but I came to speak on her behalf. And so I ended up having to stand up in the courtroom and repeating myself over and over again like a broken record, just to have the chance to be heard. And that judge was very put out that I would want to speak on that child's behalf, who we had had longer than her biological father. And she was 4 at the time. So there are lots of reasons why foster parents quit, and one of them is a lack of communication and support from workers. It is also sometimes we feel ill-equipped, and it's not because of the training. It's just no one can foresee what you're going to take in sometimes with some of these kids who are so traumatized. So sometimes it's about the stipend or the subsidy payment being too small. For us, it was watching kids return home when we felt like they shouldn't have. And just like Madam Secretary said, it was probably 2 rights. We were seeing it from the side of foster parents, and some were having to see it from a legal side, which I know absolutely nothing about. So I don't, we have fostered over 30 kids, and we have seen quite a few have to come back into care because we sent them home when I feel like we shouldn't have. Maybe it could have been foreseen, maybe it couldn't have, I don't know. Unfortunately, we had one of our foster children return home and did not make it. The child passed away. And I don't want you to misunderstand me. We're not against reconciliation. We're not. I'm all about keeping somebody's kid, giving them a second chance for them to get it together. But I am against reconciliation when I don't feel like it's in the best interest of the kids. And I feel like too many times we send them home only to continue the vicious cycle. And so for us, we had gotten to a place where we got very jaded with the system, and we felt like we were abandoning kids to send them back home to the same chaos, which isn't fair and which isn't okay, and our kids are not okay. And so we can't be naive and to think that everyone who we say is a tummy mommy wants to be a parent. They don't. They don't want to be a parent. And there are plenty of those, and that's sad to say, but that's part of our broken world, so it's just simply not true that everyone wants to be a parent. When a parent has done something to break a natural bond, we should not force what is not there. And Senator Barrow spoke about this a while ago, and I loved how she said it. I had to write it down. She said, how can we reunify when there's nothing there? And I feel like we try that way too often of kids who have no bond, who don't want to go home because of the chaos. So for us, common sense said that if they don't want to make it a priority to come to a 1-hour visit a week or every other week, they don't want to be a parent 24/7. So I've seen a dad get his daughter back after 26 months, even though he skipped more than 50% of his visits. He didn't have a job, was a diabetic who drank himself into comas where the ambulance had to be called often, and only for that dad to receive his daughter back and die a few months later, which left her living with a grandmother who never saw her in over the 2 years she was in care, but lived probably 5 minutes from the visiting facility. the DCFS office. I just can't believe that that was in her best interest. I have had caseworkers convince parents to not give up their rights, even though they clearly don't want to be a parent. They come out and say, I don't want to be a parent, I want to give up my rights. We have to convince them they want to be a parent. That is a problem in and of itself, if we have to convince you that you want to be a parent. We shouldn't take 900 plus days to give kids a place to call home with all the uncertainty and chaos going about. I don't feel like that case plans should be given 2 years to complete. I have a mom who her child was taken, and it was a wake-up call for her, but that is not the case every time. But for this mom, she got with it, and she is already receiving visits, unsupervised visits, 6 months after her child was taken. So I know it can be done in 6 months. If you really want your kids back, you'll do the work, and you'll do it in a timely manner. So I just don't feel like it's in their best interest to leave them 900 plus days in care in the uncertainty. If we wanted to, we could even make it about money. If we stop extending case plans so long, that we could let them go ahead and be adopted by those families who love them, who know them, have given them a safe place to call home, and we wouldn't be spending so much in subsidy payments. I had a family that they had had kids for 2 years. They built their house with the thought that they were going to keep these foster kids and be able to adopt them. Somehow, they ended up going home despite the parents not truly finishing the case plan. And these kids were found in the middle of Highway 167, toddlers. And when asked where they were going, they said, we're trying to get back to Tony and Sandy's house, which are alias names for their foster parents. If a toddler is willing to go in the middle of a busy street to get back to the foster family. So while fostering is not about making money, I don't feel like foster parents should be out money while taking care of someone else's kids. Most foster families are lower middle class families trying to take care of someone else's kids, myself included, which simply cannot afford sometimes the added expenses. Foster parents, we have to provide beds, dressers, that's one thing. But like for me, my biological kids are 17, 18, and 19 years old. They don't need a babysitter. They can stay at home themselves. But we chose to take a 1-year-old and a 5-year-old that are half siblings who do need a babysitter. So for my husband and I to have a night out, we need to pay a babysitter to be able to go do that. The subsidy doesn't allow for that, and you can't be reimbursed for that. I don't think that I think that would tell foster parents that they were valued if we said we wanted you to take a break sometime and we would reimburse you for doing so, that you wouldn't be out that money. I don't want you to pay for my meal. I don't want you to pay for a movie, just simply the child care for those kids for a night out sometimes. When the formula shortage was happening and you couldn't fill your WIC at once, DCFS could not reimburse for that. I don't have to tell you how expensive formula is. When a little one smears feces on your carpet and walls, there is no reimbursement for a carpet cleaner rental or paint. Yes, that happens. I've had it happen. When lice is brought into your home, DCFS will reimburse for over-the-counter treatment, which is extremely time-consuming, but will not reimburse for the more expensive one-time treatment. That's a problem. The recent increases in the subsidies for foster kids is helpful. However, it did not make up for inflation, nor did it bring Louisiana up to the average that was set by the U.S. Department of Agriculture for a little over $21 a day. Foster parents also get tired of all that is asked of them. I do not want to have to take a 6-month-old to the dentist to have her 2 teeth cleaned when I won't take my own biological kids to the dentist at 6 months old. But we now have to do that. I also think that's a foolish way of spending Medicaid money to take a 6-month-old to the dentist. We must take 15 hours every year to be recertified. That does not include repeated mandatory trainings such as how to administer medication. By the time I've done 30 kids in my home, I hope I am able to administer medication without watching a video. Sometime recently, DCFS decided to require newly certified foster parents to attend a 3-hour-long mandatory meeting on navigating foster care. Because we took a break We are considered being new into the system, but that is not an optional meeting. So they want us to go for a mandatory more 3 hours to go figure out how to navigate foster care. I feel like that should be optional, or that should go toward, if it's not going to be optional, it needs to go towards our training hours for the year. The hoops that we jump through to become certified and stay certified are too much for a lot of families. We seem to require more from the foster families sometimes than we do from the biological families. One of the changes that foster parents have seen since all of this went down, the media reporting about the House of Horror, where foster kids were being raped and the deaths of children, is more pictures being taken. So they now come into our home, they want to take pictures of us, they want to take pictures of our foster kids that we have currently, more pictures inside, outside of our home. Most of us foster parents that I have spoken with don't see how that will stop abuse within the home. Do I see that that's a real problem? Absolutely. Is that a horrible thing that we take them out of one horrific place and put them into another? Yes. But for us, a better fix would be requiring that non-school age children attend daycare 2 days a week where there are more eyes on them. That will be a problem in the state of Louisiana because we require daycares to go through extra hoops and extra costs to be certified to keep foster children at their daycare. We must help DCFS workers. They are asked to work overtime, not get paid, be on call on the weekends, spend the night at the DCFS office with a foster child that they're unable to find a placement for. And it isn't logical, like you said, to think that we can continue with such a shortage and not see tragic events such as the death of the children that we're all here about anyway. We are asking people to be married to the job, and that isn't fair. That is not okay to shorthand our kids like that, our kids, which are our future. We also spoke about the training time that is long for new workers to come on board, and with the turnover rate being high, the office is constantly spitting in the wind. While there aren't enough people desiring to be investigators or caseworkers, and I get it, I don't want to do that. I can't go see those things that they see. Other help I feel like could be given, so I was curious to know if it had ever been brought up of hiring maybe clerical staff to help our workers who have too many cases on their caseload complete things like getting children registered for school. My pre-Ker that I have currently almost missed the opportunity to get into pre-K because he wasn't enrolled in time because the worker's just busy, frankly. And so somebody that could help register them for school, purchase uniforms, school supplies, they're out doing the shopping. Our workers shouldn't be out doing the shopping. They have bigger things to do. Completing paperwork for Medicaid cards to be sent to the foster families so that we can get them to the doctor when needed. Someone to do the shopping for the initial time they come into care, or even paralegals to do the court paperwork that they have to do after a night being out at midnight, then coming home working on paperwork to be ready for court. Extra help could also be given to complete the clerk of court paperwork or the ICIP papers for the out-of-state, the daycare packets. We also have workers traveling from North Louisiana to Ellick, Lake Charles, New Orleans, seeing kids on a monthly basis. And I feel like we could hire someone else to go put eyes on those kids. If that's truly the policy that they have to be seen in person once a month, couldn't those other people be hired to make those long trips? My caseworker that I currently have, and this is just one example, has a case in Lake Charles. So she spends 8 hours on the road going to see the one child and then still hasn't done the visit. She's already over her day, her work day. Could a Zoom call be done once a month and an in-person visit the next for placements that are more than an hour and a half away? Another problem that we just spoke about, which I was glad to hear that we're on top of, is 2 transportation workers for all the entirety of Ouachita and Caldwell Parish. And we know that's not enough. That leaves workers also having to be the ones to come pick up kids and transport them and to fill in the gap. My foster kids today were picked up way earlier than needed. So one was checked out of school early and one was picked up from our house early where my girls were keeping her because she needed to use the transportation vehicle that was available to get it back soon enough for the other worker to take it. So the 1-year-old we have and the 5-year-old who needs to be in school because he's behind like most had to be checked out early to go sit at DCFS so that someone else could use the vehicle. Children, parents, family members, foster parents, we usually know when care is lacking, and a lot of times we know a good bit before the headlines appear. Right now, as it is, it takes the media to get a hold of a tragedy like it did this one to garner attention. Louisiana has ranked at the bottom for child well-being for the past 3 decades. We are 1 out of approximately 5 states without a children's ombudsman. The other 4 states are also ranked among the worst in the nation for child well-being. We currently do not have a person or official in the Louisiana state government that is responsible for hearing grievances related to Louisiana services for children. We do not have anyone resolving complaints or reporting to the public, the governor, or the legislature. If we had this, I believe we would be able to keep workers and foster parents longer. We desperately need an independent listening ear that can build trust and increase transparency with DCFS. I believe an ombudsman would do that. Did you know that DCFS can currently get overtime pay, but it is set to last only through the end of the month? The overtime pay is actually only approved for certain things. If a worker wanted to stay late and fast track a foster care home to be approved sooner, that would not fall under being qualifying for overtime pay because technically it's not due yet. But we're so short homes, and you have a worker willing to stay to fast track that home, but they're not going to get paid for that. If we're truly 400 plus workers short in the state, and I believe we are, how do we not have the money to pay overtime? There are people that have fostered and now adopted their foster child, and they would like to take a short break from fostering. Did you know that there are workers that are telling them that if they take longer than a 30-day break, DCFS will work to close their home, and they will have to work to be recertified to take the 30 hours of training over and to go back through the whole process? How silly that we would run off good foster parents because they dared to ask for a 2 to 3 month break. And I don't know that that's policy. I'm not saying that's policy. I'm just saying what we're being told. Did you know that workers often transport kids in the wrong car seats? Infants are brought to homes in forward-facing car seats. Toddlers are brought in backless boosters, both of which are illegal. Foster families now are required to complete a car safety course, but you guessed it, that doesn't go towards our training hours either. I'm not knocking DCFS for that. I believe they get a call and they go out late. They don't even know the ages of the kids, their weight, the things they need to know to have the proper seats. But it's another thing we need to look at of how can we make sure that they have the proper seats to be transported. A little side note for you, the car seat training had a snippet in it at the beginning of a lesbian couple speaking about adoption. Had nothing to do with car seat training. It was not the time nor the place to push an agenda, and many foster families were offended that the car seat training was used in that way. Did you know that daycare is only provided to parents who work full-time outside the home? You cannot have a part-time job and daycare be covered by the state for foster kids. There are many homeschooling families, I myself included, that choose to foster, and although homeschooling is a full-time job, those families cannot have daycare covered either. We have homeschooling families that are great families that would probably be willing to take another child or two and can be certified to do so, but we can't take another one and manage our school day to make sure that our biological kids get what they needed. So we have to choose. And of course, we have to choose our own. Did you know that according to NOLA.com, over the last 5 years, it has taken Louisiana an average of 127 hours to open a child welfare investigation after receiving a report of abuse or neglect? Just to give you an idea, Mississippi's response time is 39 hours. Nationally, Louisiana ranked among the slowest in the nation for its response times in 2020. We should not be surprised when Baton Rouge alone has only 9 full-time investigators and needs 25 at a bare minimum. But we should be bothered, and we cannot think it is logical that one person can do the work of 3. I'm wrapping it up. There was a judge in Baton Rouge that was quoted back in May because he had 3 kids die that he was overseeing in court, and he says that is in 1 month. That's more than he sees in an entire year sometimes. And I quote, he said, "A kid is going to get seriously hurt or die. We're going to find out that DCFS dropped the ball. The legislature is going to be mad. They're going to call hearings, but they're at fault for woefully underfunding DCFS. In the past several years, the legislature has funded things like a dog park. We've given $1 million to one booster club. We've passed on restoring the funding to DCFS. I am sure there was misuse of funds somewhere in the past, but however, DCF funding has yet to recover from the cuts that Governor Jindal made. We're still reaping the benefits, not the benefits, of the cuts that he made. And in 2021, the legislature had to cut the requested funding from DCFS by almost 27%. The article I just quoted with the judge's prediction also contained a quote from Governor Edwards' Transition Committee in 2016. He said, "Funding follows values, and if we truly value the safety and well-being of our children, we must find a way to fully fund the work of DCFS." That is well said and so true. And I do believe that foster families, caseworkers, supervisors, the governor, and the legislature have to work together to fix the mess that has been created if we truly value our kids. We must all work together to be a part of the solution and not a part of the problem. And my prayer and my hope is that because the media got your attention and you're here listening now, that those kids' death will not be in vain, nor the kid that we sent back home years ago that also died. We have an opportunity, all of us, and a responsibility that God has given us to make the changes necessary to show our children that they're valued. I thank you for your time. I did want to say one more thing. Senator Mizell, you had said that we have kids living miserable lives, and I do believe that that is true. And this affects, so many things, and I'm not going to bore you with the statistics of how many of our foster children make up the statistics of our prisoners and our homeless. But nationally, 50% of the homeless population has spent time in foster care. 50%.
Thank you so much for your testimony, and I'm going to turn it over to Senator Mizell and Senator Barrow because they'd like to address you further. But I think I'm speaking for the committee and the staff. In all of my years of being here, you hear a lot of people get to this table and they complain. You not only said, here's the problem, you also said, here's the solution. Right. This is one of the few times I've ever heard a testimony where you would break it down into, we have a major problem here. Here's what I suggest that you look at. You did a fabulous job. I saw the department taking notes. I saw the department shaking their head in agreement with you. I see they're documenting it. We'd love a copy of your testimony so that we can kind of see if there's some things we can also work on. But your experience and your life values that you shared with us have helped us to work even better as a committee. And I will tell you, the heart of this committee is to hit this issue by issue. So I just...
that was very comforting today to see everybody working together.
Well, we just... Thank you so much. And I'll turn it over to the senators. But thank you so much.
Yes, sir.
Senator Barrow?
Thank you, Mr. Chairman. And I want to commend you, Mr. Chairman, for running such a great committee. And, one of the things that I really am going to hate is the fact that term limits, right? Term limits get rid of a lot of great people. And he has been a fabulous chairman who really is committed to this work, and not only is committed, but is very knowledgeable about it. And so I just want to say thank you to you for that and your commitment to these issues. And Representative Turner, thank you so much for bringing Miss Christie, who has done a fabulous job.
We worked together about 20 years ago. She's intimidated me ever since. So I just say yes, ma'am.
I can see why. But you talked about, well, before I leave to you and go to you, driving a race car, you can tell that requires that you have to have courage, right? And you can't be fearful to do it, right?
Yeah, yes, ma'am. That's why I wonder about you.
But you talked about my quote, but I wrote down one of your quotes. Everybody who's a Tommy mommy, does not mean that they're ready to be a mother. And that is so, that was just so startling to me and such a great quote. But I think the chairman kind of summed up what I was going to say, because I saw the secretary and the assistant secretary both shaking their heads, taking notes, and I would love to see your notes because you said so much, and I was trying to take notes. I know that I didn't capture everything, but you did give a lot of great solutions, and there are some things that we can definitely, I think, are easy or should be easy fix that can make things a lot simpler. But I want to thank you for your courage. I want to thank you for your service, and I'm glad that you and your husband decide to get back into this arena because we need you. Thank you so much.
My husband did not come up here, but he is the one that keeps me off the cliff of taking like 5 and 8 kids, and he is 100% on board for sure.
This is also for them an expense. He works. We work. He's taking off today. This is a 10 or 11-hour day for them to drive down here to sit here, listen, and be involved. So I'm proud to represent them and to know them and call them friends.
Thank you. Again, we need you. Thank you so very much. Thank you for taking out the time. Thank you for being here.
Very well said. Madam Pro Tem?
Thank you, Mr. Chairman. I just want to echo what you've already heard, but I was going to recognize the man sitting over there being quiet and just listening with the pride that he must have for you. And I want to thank you for your sacrifice, your commitment, and your courage to come here. I get emails all the time from people who are fearful of openly saying what you said so clearly today. And I want to thank you for that. But on that thought, are you part of the Foster Caregiver Advisory Board?
I am not. The advisory board required that you had been in it. If I'm wrong, someone can correct me. It was a year, and we had just gotten back into it. And so we have not been back in it for a year to be able to do that yet.
I don't want her coming down here.
She can do a Zoom call.
Well, but I hope that day one, that Foster Caregiver Advisory Board sees the example that's been set. So that's incredible. But I just want to thank you. And you got a pretty good rep over here.
Yes.
Yeah. Thank you, sir.
It's fabulous.
I think we should give him one more round of applause, don't you?
Hey, can I say a thank you to somebody since we're all being like, oh, thank you and everything?
Yes.
Chip. I mess with Chip every day I can at the Capitol. He takes my calls on Saturday morning, Saturday evening, Sunday.
The look
He'll
on
walk
his
out of
face.
church.
The look on his
30,
face.
9 o'clock at night. He'll call me back.
He does.
I couldn't think of somebody better to represent this department and to help us, even when there's not very much help to give. And I'm wearing a better tie than him today, but I just want to say how much I appreciate him and thank him and all the work he does.
I agree. Thank you, Chip. Thank you.
I hope my tie is better.
I do see y'all before we do adjourn.
You realize he's a lawyer, huh? You're saying all those nice things about a lawyer?
He's not practicing like you. I like you.
Y'all, it's good we can laugh a little bit. It really is. I do see, before we do adjourn, I do see there is one more card,
Chairman.
Caluet, that is asked to testify. So the floor is yours.
I brought some presentations for all of you. Am I able to pass those out?
Yes, we'll get that to you. We'll oh. Okay, I'm so sorry. As you're coming to the table, I do have 2 late cards. Baron Decato, or you with the civil service. We good on that. And no, these are just not just, but they're just here for expert witness. So the floor is yours, and welcome to Senate Health and Welfare.
My name is Callie Caluet, and I'm here today to discuss a few topics concerning DCFS, specifically child welfare. As you can see on page 2 of my presentation, I've worked in various roles within foster care as well as surrounding systems over the past 7 years. I've used these experiences to compile a presentation of areas that need improvement. These areas can be read on page 3 of the presentation. These areas include report response times, problems with the kinship care program, and inappropriate use of hospitals as placements. The first area I would like to discuss can be found on page 4. I've attached some statistics regarding the response times of DCFS after a report's been made. The most recent AFCARS data that can be found is from 2020. As you can see in the data set, we receive 10,000 less reports a year compared to Mississippi, and yet we take 120 hours longer on average to respond to allegations of abuse. On average, Louisiana, according to 2020, it takes 153 hours or 6 days to lay eyes on a child who is suspected of being abused. For a child experiencing abuse and neglect, 6 days can feel like a lifetime. We've even seen several children pass away before DCFS responds. If they are already struggling to meet those reports, how will they be able to manage the human trafficking allegations that they have asked to be streamlined into the central intake system? The next topic I would like to discuss is on page 5. This topic is near and dear to my heart because this past year I was a fictive kinship placement for a beautiful 6-year-old girl. Of all the experiences I've had with the DCFS system, this one was the most impactful. I had only ever met this child one time prior to her worker asking me if I would take placement of her. According to the Federal Kinship and Fictive Kin Act, a child should only be placed with a relative or individual who has an emotionally significant relationship with a child. And yet DCFS allowed me to take home a little 6-year-old girl who didn't even remember meeting me. This Kinship Act is based on rigorous research about how kinship relationships lessen the traumatic effects of foster care. Unfortunately, Louisiana DCFS has drastically bent the meaning of this act and allows virtual strangers and acquaintances to take placement of children. The purpose of this act has lost its meaning due to their desperate attempt to find homes for these children to stay in. So now we have near strangers caring for foster children with no foster care training in place. As you can likely imagine, this sets both the family and the foster children up for failure. The kinship model only works if the child actually has a bond with the potential family. I propose that DCFS implement a bonding assessment prior to placement to prove that an actual bond exists before placing a child into a fictive kinship home. If you turn to page 6, you'll see that the problems with kinship care go even deeper. DCFS does not seem to want to acknowledge the financial burden they place on kinship families when they place these children in their care. In its Expenditures on Children by Families report, the USDA puts the cost of raising a child around $12,980 per year, or $1,000 a month. Most kinship families cannot afford adding more children to their household without some kind of financial support. Currently, there is a kinship subsidy program available, but it's only available to blood relatives, and it is less than the minimum board rate that foster parents get. My proposed solution is that fictive kin and kin families should be able to sign a waiver citing their intent to get certified, and DCFS provide room and board while that family goes through the certification process. This is a common practice in many states that we should adopt in Louisiana. The second component to this problem is the actual certification process. The state of home development is a disarray. We had our foster placement for 6 months and we still did not get certified by the end of that 6 months. They frequently lose paperwork, they require you to attend a Journey Home classes live at very inconvenient times, and the entire process is inefficient. This can be solved several ways. Firstly, the required Journey Home classes could be switched to on-demand via the Louisiana Child Welfare Training Academy portal instead of live. This would allow families to access the training when it is convenient for them. Second, the entire certification process should stop being on paper and go onto a site like Certime. The state is already using Certime through LA ADRA for licensed addiction counselors, as well as the State Board of Social Worker for licensed social workers. It is proven to be efficient in handling hundreds of applications along with thousands of renewals every year. This would allow families to upload all their documents to the website, they'd be stored in a secure place, and the system would keep track of where applicants are in the certification process. This would provide transparency on both sides where a delay may be happening if a delay occurs. Using paper leads to inefficiency, lost documents, and errors, which leads to frustration within hopeful potential foster families, and they inevitably give up on the process of becoming certified parents. And my last talking point of the day can be found on the next page, which is inappropriate use of hospitals as a temporary placement. We have a major problem in our state that rarely ever seems to be discussed. We also experienced this problem during our kinship placement. Our foster daughter's brother spent 4 weeks at Children's Hospital, not because he met medical necessity for 4 weeks, but because DCFS could not find him a placement. The longer he stayed at that facility, the more his behaviors worsened. He felt trapped on a locked unit with no family to call his own. I wish I could say that this was a rare occurrence, but it's very common. I've worked in inpatient psychiatry for the past 6 years, and it happens on a daily basis. The hospital I currently work at has a child on our unit that has been there over 100 days. Children and teens in foster care are placed into acute psych units when they're homicidal, suicidal, or their behaviors become too much to manage in the home. The family will put in notice with DCFS and say they're unable to take the child back. DCFS struggles to find placement for these children and will leave them at the unit for weeks and sometimes even months. It is harmful and neglectful to leave a child in the most restrictive environment possible when they are clinically ready for discharge. If a biological parent leaves a child on a unit and they refuse to pick them up, we report it to DCFS, and that parent is charged with abandonment by DCFS. So why can DCFS leave children in hospitals for months at a time and it be considered ethical or appropriate? It is not only harmful to the children, it is harmful to the taxpayers and the DCFS budget. When a child no longer meets medical necessity, DCFS must either pick up the child or pay for the child to stay on the unit. Due to not having a placement, they opt to pay a daily rate instead of picking them up, and they leave the child on a locked unit. If you look on the next page, you'll see my breakdown of the cost of care in different settings. I use my former foster daughter's brother as the example. He spent 30 days on Children's Unit. At around $100 a day, that cost the taxpayers $21,000 just for his one stay. The same 30 days would only cost around $560 in a foster home. That means it is 37 times more expensive to leave him on a unit than to have him in a foster home. There are dozens of children at different psych facilities across the state on any given day, racking up hospital bills that DCFS will pay for, and in turn, taxpayers pay for. It would actually cost half the price to hire a sitter to sit with that same child in a foster home with a capacity waiver in place. There are several homes in the state willing to take in additional children, but they're told by home development they are not allowed to have more than 6 children in the home. Foster children who board in psych units while waiting for DCFS placement take beds away from Louisiana's children who are in crisis and actually need those beds for mental health care. Leaving children in crisis to board in the ERs, waiting for a bed to open up, and it delays care they desperately need. I propose that there be a new policy implemented that limits how long foster children can sit on a unit before they no longer meet medical necessity. And finally, on the last page, you can see my proposed solutions. Thank you so much for your time, and thank you for caring about the welfare of Louisiana's children.
You are amazing. That was I'm trying to drink a sip of water out of a fire hose. That was really, really remarkable. And your experience, what are you doing now?
So I work in inpatient psychiatry still, and I'm also a counselor in training. So once I am finished with counseling school, I'll be seeing adolescents and young adults. And I did want to say one more thing. You guys were talking about the MCOs and how you guys are working to get a contract with, you're working through the contracts with MCOs about what they offer. It's great that they offer psychotherapy, but if you look at their reimbursement rate, it is tragic. So I'd like to bring that to your attention real quick. So in Louisiana, for Medicaid, they pay $69 for a kid therapy session. Our neighbors in Texas pay $100 for a therapy session, and our neighbors in Mississippi pay $119 for a therapy session. Therapists cannot make a living caring for kids through therapy for Medicaid, paying such low reimbursement rates. That's why there's no caregivers to do therapy with these kids.
So you can't form a network.
No one's taking Medicaid on the therapist network because it doesn't help their livelihood to do so. It's honestly so sad. We want to provide care to those kids, but we have to be able to feed our own families, which means that Medicaid needs to increase that rate to at least match our neighbors in the cost. So
I guess I would just ask this question as it's a kind of an informal meeting that we're working together. Do y'all all know each other?
No, not
Well,
yet.
can y'all please, after this is over, can y'all spend some time together? Because from our previous testimony here, there's a lot of practical expertise. So just from there, I just would like y'all to get to know each other better.
Yeah, Senator Mill, thank you so much. You know, we got a packet too. We'll be looking at the things that came up. I think the thing that we want to make sure we're listening.
You have, and I have to say, for the people that testifying, they were taking notes, they were in agreement, so it wasn't as though this was a confrontational, we don't believe you type scenario, because we could see it from this vantage point, very cooperative. But I would like, maybe once this adjourns, you all drove far and you sacrificed your time. Maybe y'all could spend a little time, exchange some phone numbers. As you see best practices, you continue to talk to each other, because that's kind of what this goal of this committee is to bring more open communication and solutions. Senator Mizell, you did have a question or concern.
Thank you, Mr. Chairman. You were incredible. You talked so fast, bless your heart. I wondered if you'd started at the beginning of the meeting, if you would have talked as fast as you talked at the end.
Probably not.
Okay.
No, you.
But I just want to commend the fella that sits right here, because we're not having the conversation we've had. This has been the most encouraging meeting I've seen in a long time, because we, just as you mentioned, we confronted problems head on, and between people who are in the trenches and the people who are trying to change the outcomes, we're in a different place. I'm really looking forward to where we can go from here. And he's got a birthday in 2 days.
Oh, Lord.
So, I hope you know what's taken place. I hope you feel really good about it.
I love this committee. I love our staff, and we might make a lot of mistakes, but we care. We care.
But thank you.
Thank you. And y'all, I guess let's leave on this last note, y'all. Let's leave on this last note. So many people watch this testimony, and once again, I know I'm speaking on behalf of the committee and our staff here, is we thank the workers at DCFS. They get up every day, they make a difference. Yes, we have some issues, but we thank them. And if anybody's hearing us speak, is we're just trying to make it better. And when you make it better, sometimes it gets a little tough. And for y'all to drive from this system, and I guess the last thing I'd end on this note is, if anybody else wants to come to this table and testify with, here's the problem and here's the solutions, these two ladies showed that you can come to the table and say, hey, there is a problem, but I have a solution and I want to work with you. So on that note, I think we have a motion by Senator Pope to adjourn. I thank the staff. Oh, okay.
Mr. Chairman, I think that I want to make a motion to wish the chairman happy birthday.
Oh, thank you. Thank you.
I'm not going to sing, but we'll wish you happy birthday.
If I have to blow out some candles, we'll need a Acadian ambulance with all the candles we have to put on it. Thank y'all. I love y'all all. Thank you.
Thank you
Motion
so
adjourned.
much.
So proof.